YouTube. And it's 6:30, so I will start the webinar.
Hi, everybody. Welcome to PACER's 2024 Housing Starting the Journey workshop series. Tonight is the second workshop in the series on housing eligibility and funding. And my name is Susan Shimoda. I'm the Housing Project Coordinator with the Transition to Adulthood group. I'm also the parent of two young adults, one of whom has autism spectrum, living in his own apartment with support services, and the need to advocate for appropriate services and supports led as a child, it led to a profession change and my position here at Pacer Center. Also joining me tonight are our two co-presenters, Jerry Malliam, the Senior Planning Analyst with Hennepin County Human Services and Public Health, and John Petroskas, the General Assistance Minnesota Supplemental Aid Policy Lead with the Housing Division of the Minnesota Department of Human Services. My colleague Sue Fager, who is the coordinator for the Transition to Adulthood project, will also be assisting us tonight to answer some of your questions. Just for some of you who were here last for the first workshop, a quick overview that PACER was founded in 1977, and we are the Minnesota Parent Training and Information, or PTI, mandated by the federal government in each state. And we're also the member of an 18 group disability coalition that we collaborate with. And most of us who work at PACER are parents, or we have family members of children and young adults with disabilities. And I say that the beauty of PACER is that most of us have been there. We're funded by state and private grants, as well as federal and fundraising. And the housing project was funded by a small grant starting in 2003. We have a variety of programs at Pacer Center. Our Simon Technology Center, National Center on Transition and Employment, and our Children's Mental Health, just to name a few. Just a few housekeeping items with a disclaimer that Pacer Center staff are not acting as attorneys and cannot give legal advice. And the contents herein are for informational and educational purposes only. And it's not meant to be legal advice. If you have those legal questions, we ask that you contact an attorney. So we have a lot of information to cover tonight, and we'll be taking your questions via the questions feature like we did last time. We will review them as we go, but we're going to mostly address those tonight at our break about halfway through. So we're looking at doing the first presenter for about an hour and having about 10 minutes for those questions, and then our second presenter in another 10 minutes. We won't have time to get into individual situations, so please put your questions on the Q&A tab in your Zoom navigation bar, and our webmaster, Jamie, myself, Jerry, and Sue will field those. If we don't get all to your questions tonight, please go ahead and we will have your email to follow up. Some of you had an anonymous email, so again, we can't follow up. So just make sure you go ahead and email us as well. So when the webinar ends, you will have the ability to complete PACER's workshop evaluation. And in addition, the evaluation link will be sent in an email 24 hours after the workshop or tomorrow evening. Once you complete the evaluation, look for the second link to the certificate of attendance. And it is really important that you respond to this, as it is a free workshop to you, and we use it for reporting purposes, but more importantly, we do use it to make changes for future workshops. And once you answer the email, if you need that certificate of attendance, you'll be sent a link to download it. Next, Jamie. So PACER, just to recap for some of you that did not attend the first workshop, where do we start? I will do just a quick recap. We did design this three-part housing workshop series to cover introductory concepts for planning, funding, and housing options. And we consider these foundational building blocks to assist you and your young adult on your housing journey. Some of you might be just starting the process, and some might already be in different parts. So it's important that you realize that it takes time, and you're not going to learn it all in a three-part series. You will need to network, do additional research, and work to understand the information, just as many of you has had to do for the IEP process. You may also want to come back to the workshop series again next year, as many of you have done, as we continue to be in a significant time of systems change, along with the direct care workforce shortage, the lack of affordable, accessible housing. And so new changes and developments are happening every year. Next, Jamie. Again, all our housing publications and workshop materials are on the slide deck. You should have received that link when you received the link to this presentation. So I would encourage you to go ahead and click on the housing navigation chart, which is the one on the very right there. We're going to be using that again. Jerry and John and I will be using that to lead you through the process. And again, our housing guidebook is online. It isn't in print form anymore, but we are making changes to that as we go. And then our series of tip sheets on advocacy tips, terminology, and getting started, as well as all the other fact sheets for some of the funding streams that you're going to be, what we're going to be covering tonight. I know it looks really overwhelming, and a lot of you did say in your evaluations that, it is a lot of information, and it is, but I think Pacer's view has always been to put it out there because you are at different parts in the journey, and you might come across something in the future when you're just getting started that you remembered in the workshop, and you can go back and access that information. So next, Jamie. So this workshops will address the process for eligibility for housing services and supports. We're going to talk about some of the main funding sources from federal, state, and the county, which we actually covered in the last workshop. Rental resources, the public housing and Section 8 program. And then we're also going to be talking about housing funding supplements and payment examples. Next, Jamie. To recap from workshop 1, we do want to just hit these really quickly, just so you kind of put this in context. Again, why should you start thinking about housing and services now? Because the IEP team must consider independent living as part of the transition IEP. Your son or daughters are experts on their strengths, gifts, and preferences, and that housing options involve eligibility criteria, timelines, and waiting lists. And we do have a limited availability of affordable housing and support staff. And next, Jamie. We do think that you'll want to look for a life and not a home. We did talk about that. I'm sorry, a life and a home, not just a place. We did cover that at length on kind of what that meant, not looking for a placement, but looking to create a meaningful life. Next, Jamie. We also talked a little bit about why housing is evolving, and that parents and individuals with disabilities are demanding housing and services that are integrated and based on the person-centered thinking principles. Next, Jamie. And second, that the federal government's directive to implement the Olmstead decision that requires states to eliminate unnecessary segregation to ensure that persons with disabilities receive services in the most integrated setting appropriate to meet their needs, meaning in the community rather than institutional placements. We discussed that Minnesota has an Olmstead plan, some basic concepts and terminology that we really think is important for you to learn. So because you are your young adult's lifelong advocate. And our terminology sheet has some great information that we'd like you to cover and learn. Next, Jamie. And third, in 2014, the Centers for Medicare and Medicaid Services had a directive to implement what they call the Home and Community-Based Services Rule, which are rules that created new standards for all people in the United States who receive publicly paid long-term services and supports. And they must receive those in the most integrated setting and have full access to the benefits of community living. The rules are intended to provide a single definition of what home and community-based services are and what they are not. And they are meant to enhance the quality of home and community-based services and provide protections to participants. And again, the overall principles were under the settings rule state that a person with a disability gets to control where they live, who they live with, how they earn their money, where they work, and what they do during the day, and who they spend their time with. And next, Jamie. And last, separating housing from services. And we did talk a little bit about that in May 2023, Governor Walz signed the 1.65 billion housing omnibus bill, along with additional legislation, which is the largest single investment in our housing state history. We did talk that Homes for All Coalition was a catalyst that united families that were comprised of 240 statewide organizations, advocates, individuals, and families came together to make a statewide investment in housing stability across the housing continuum for all Minnesotans. And we also discussed some of the largest funding streams that are allocated to the state agencies. And those agencies are Minnesota Housing, the Minnesota Department of Employment and Economic Development, and the Minnesota Department of Human Services. We touched on a few grants targeted toward the 7 key needs that address the rental and home ownership, affordable housing and new construction, and preservation, homelessness prevention and home ownership development, and rental and down payment assistance. And again, that funding comes through those agencies that is meant for all of you, not necessarily directly to you. I know we had several questions about that. Next, Jamie. We also spent quite a bit of time on the critical foundational concept on person-centered thinking and planning that is required by the law, and it provides critical information and direction for independent living options. We talked how to identify important rituals and routines, supports, and services that have been provided in your family home that all these years to enable your young adults to have that feeling of home, consistency, comfort, and control when they are now to live in their own home. And so we recommended that you get started to create your one-page profile or description to identify what is important to and for your young adult and how to best support them, and use that tool when beginning to work with a variety of providers of housing services, as well as other services like medical, searching for roommates, and interviewing support staff. And so if any of you did do your one-page profiles, I'd love you to send that in through the Q&A. I'd like to see who did that. It would be great if we could share some of those in upcoming. You'd like to send those in. Next, Jamie. And then also we did do an overview of some of the current housing options. Again, this is a very broad overview. Some of you might have been a little confused because 2 weeks from tonight, on April 29th, we will wind up the housing series talking about specific examples of housing and services. The overview we did was just to give some real life examples with some budget examples, just to give you an idea of what's out there. But in our third workshop, we do cover a variety of disabilities and a variety of models. And obviously we can't do those all in one workshop. So over the years, PACER has strived to be able to balance those. And so if you don't see your son or daughter's or young adults specific disability, email us. We do have a trainings page, and so you can view previous third workshops and lots of great stories, again, from that variety of disabilities. And again, so right now we're going to talk about how we start the process, and know that there's not one way to secure housing. It is an individual journey. It's helpful to talk to people who have been there. And reality, we talked about there's going to be waiting lists for certain programs, and that housing is not an entitlement, that you do need to meet, your young adult needs to meet eligibility criteria set out by the state. And although we'll be going through the housing navigation chart as a group, you will personally need to sit down and kind of work through your individual solutions with your young adult and the people that you get onto your team. And if you don't see how you can meet, your young adult can meet that eligibility criteria for housing and services, we do believe that you can come out of the workshop with a few tools to get started on first steps. And again, all of our information and our contact is there for you to reach us. So with that, I'm going to ask Jerry to come on and introduce him again. He was here last workshop. We really appreciate his work with Pacer Center. He's the Senior Planning Analyst with Hennepin County and Human Services Public Health Department. And Hennepin is one of Minnesota's largest county. And Jerry has worked with people for disabilities for 35 years in group homes, day programs. He's been a guardian. He is a guardian and was an advocate for ARC Greater Twin Cities, which is the ARC Minnesota, for 8 years. He does provide ongoing community staff training and supports vocational services, housing, and self-directed services, and provides information about county services for anyone that does not speak English. He's a certified person-centered thinking trainer from the Learning Community on Person-Centered Practices, and he was chosen as an award winner from the Minnesota Department of Human Services and the Board of Aging for promoting exemplary practices. So Jerry, again, welcome, and we can get started. Next, Jamie.
Great, thanks everybody. I'm happy to be here. This navigating the housing and services process is really important. It gives you kind of a step-by-step guide, kind of going through it, how your young adult pay for housing and services. We're going to talk a lot about that today and divide up the categories and what's your vision for community living. Talk about where do you want to live and what is your vision. So do you have anything more to add, Susan?
Not really.
Okay.
We talked a little bit about, again, that first, this first page we really covered in workshop number 1. And again, just to remind everybody, that is online. We have a link to it. So I really recommend, if you missed that, to go back and take a look. But yes, next.
Okay. Kind of going through there, one of the first steps is to contact your county and request an assessment for services. An assessment is determining what level of care, what level of service your loved one will end up with, will be assessed for. Everything is based on assessed need. So there's different categories and different services to choose from. When we talked about all these services so tonight, talked about waiver, medical assistance services, and adult mental health services. Next slide. So the county has certified assessor. Hennepin County has hundreds of certified assessors. Other counties have many certified assessors. They use a document called MnChoice's Assessment, and it's a standard list of questions they ask everybody to determine their level of care. You want to apply when your child or your person is in high school by age 18. That's really helpful. A really critical thing is to write down the name of the person who you contacted, maybe their supervisor's name, the date you called, and what they said, so they can keep their promises. Next slide, please. Medical assistance is really important because medical assistance pays for the lion's share of services that we're going to talk about today. It's a federal program. Money comes from the federal government, the state of Minnesota, and local counties, but the federal government manages medical assistance and Medicare. The Department of Human Services manages the program, but it's administered by counties. Next slide, please. To qualify for medical assistance, you qualify in 2 ways: by being certified through the state medical review team, which is a process through the Department of Human Services, and certified through the state, through Social Security. If you have Social Security or you've been SMRTed, you are now certified as a person with a disability. So next slide, please. This goes into a little bit of detail. There's some websites here that you can check on, socialsecurity.gov. The SMRT process, again, starts at the county, but it's completed by the state of Minnesota. SMRT stands for State Medical Review Team. You can contact your county or initiate it at the website below minnesotagov/portal/government/local/counties. It'll give you a list of counties and your local contacts for that. Next slide, please. There are a range of disabilities, as you know, that people live with, basically. A more common one is called developmental disability or related condition. The characteristics are a person that has an IQ of 70 or less before they're age 21. We look at developmental, we look at that before age 21. Deficits in adaptive behavior and substantial limitations in the areas of being mature, learning, personal independence, and social responsibility expected for a person their same age or someone as an age-appropriate assessment. Next slide, please. In addition to that, a really important area, because some people might have an IQ higher than 70. People with autism often have higher IQs. So there's another assessment that we consider called related condition. So it's a severe and chronic disability attributed to some of the common ones will be cerebral palsy, epilepsy, autism, Prader-Willi syndrome, and others. As well, you can go back to the slide you had before. There we go. And it's not a mental health disability. If your primary diagnosis is mental health, that's not what we're looking for. In addition, we need substantial functioning limitations in 3 of these areas: self-care, communication, learning, mobility, self-direction, and capacity for independent living. Next slide, please. Children's mental health is another scale, another determination, another set of criteria, meeting one of the following criteria, including admitting to the last 3 years at a risk of being admitted to inpatient or residential treatment, having received inpatient residential treatment, having a diagnosis of mental health, psychosis or clinical depression, a risk of self-harm, psychopathical symptoms as a result of physical, sexual abuse, or a psychic trauma within a year, significantly impaired home community functioning lasting at least a year, or a written opinion by a mental health professional represents a substantial risk lasting a year. So those criteria are a little bit more flexible, a little bit more broad perhaps than developmental disability. Next slide, please. For adults, there's some different criteria: acute mental health, serious enough to require prompt intervention. Serious and persistent mental health meets one of the following criteria: 2 hospitalizations within 2 years, hospitalization or residential treatment exceeding 6 months in the last 12 months, diagnosis of several mental health symptoms, including bipolar disorder, depression, borderline personality disorder, significant impairment in functioning, a diagnosis from a mental health professional in the last 3 years, stating the person is at risk of requiring inpatient or residential treatment, an adult that has in the last 3 years been committed by the court as a person who's mentally ill. People with mental health issues sometimes have they get better and then they have more needs for support. So it's kind of a cycle, tends to be a cycle. Next slide, please. So MnChoices, a little bit more detail, is a comprehensive standardized assessment tool for the state of Minnesota, which assesses all, if not all the services that we're going to talk about tonight. It replaces several other assessments we had before, including the DD assessment, PCA assessment, private duty nursing assessment, long-term care assessment. It's person-centered. So within the assessment, we talk about what's important to you, what's important for you, and that balance in between. It creates a plan that summarizes the results that the providers and the case managers are supposed to follow, and embellish a little bit, write a little bit more about that person. It gives people the next steps based on the person's needs. And so it'll also indicate what services the person qualifies for. Next slide, please. People with disabilities and their legal representative, their parent or their guardian, are required to be a part of the team, as well as a certified assessor. The people that are not part of the team are people that are the providers. They have a conflict of interest, so they're not invited. Additional people that could be attending could be a relative or support person, county social worker, a mental health professional, or a nurse. You might, as a parent, guardian, or as a person, want to invite them specifically to come. They wouldn't automatically attend that meeting. Next slide, please.
Hey, Jerry, I just wanted to mention to the audience too that we have a good brochure on Min choices that say what are the steps. So I would encourage you to go ahead and take a look at that if you'd like to know how to get specifically started on calling your county and requesting a Min choices assessment.
Right. Documents you'll need when you make that call to the county, or when the county visits you for the assessment, they're going to want these. It's helpful to have that one-page description that we've developed with you the last time, or talked about the last time. It's required to have your legal birth certificate, a social security card, your educational records that you had, your individual education plan or related documents from school, and medical records, and all the comprehensive medical records. The more current, the better. Within a year is really great. And social history. Where were you born? When did the disability occur? At what age? What was the result of it? What has caused you difficulties since that period of time? So these are the typical documents needed. Next slide, please. The areas you're going to be assessed on are many. It's like all of them, basically. Think about this: your personal information, name, address, phone number, quality of life things. What's important to you? What's important for you? What are your hobbies? What do you want to be doing in the future? Your activities of daily living, your instrumental activities, health, psychosocial. Who's your friends? Do you have good relationships with people? Do you get out and about a lot? Memory and cognition. They're a little tricky. They'll ask you a question, and then later they'll say, well, what was that? What was that situation again? And then you have to kind of remember it later. Sensory and communication kinds of questions, safety and self-preservation. Can you respond to a fire drill? Can you respond to an alarm? Employment. Are you a person that is seeking employment or not? If you're not, then they won't ask further questions about that. But if you are, then they'll go down and ask further questions about, and also volunteering and training that you might need. Housing. Where do you want to live? We're talking about that today. An environment. What kind of a place do you want to live in? By yourself, with other people? What's your self-direction? Can you tell people what you would like in life and what you're interested in? Caregiver supports. What kind of a caregiver would be best for you? Is it skilled or qualified, or just a typical person? And then from that, the assessor builds conclusions based on the scores, and will tell you what kind of services that you would qualify for based on that assessment. Next slide, please. Mental health has a functional assessment. And so they talk about many things: mental health systems, medical and dental health, social functioning, interpersonal functioning, financial assistance needs, current housing and living conditions, use of drugs or alcohol, if that's applicable, or historic use of drugs or alcohol. These questions come up over and over because they lead to future problems if there's been a history of that as well. So like the Min Choices assessment, the functional assessment for mental health is quite comprehensive and really tries to dive deep and unpeel the onion, so to speak, to find out as much about the person as possible so they can provide the supports that are needed. Next slide, please. What's the level of care? So there are several things to consider. Levels of care of a hospital or a neurobehavioral center, a nursing facility, an intermediate care facility for people with developmental disabilities, a residential or a regional treatment center. So people that have developmental disabilities might be at the risk of care of an intermediate care facility. That means it's institutional in nature. It's required to have a dietitian, required to have a nurse, and they have fire drills sometimes in the middle of the night, sometimes during the daytime. And hospital level of care, there's services that provide nursing 24 hours a day, 7 days a week, if you need that as well. So the level of care is really important to determine. Next slide, please. So when you have an assessment, that's a time to prepare. It's a time to be ready for the assessor to walk in. From the time they're driving down the street until they reach your house, they're assessing the situation. They're looking at the neighborhood. They're looking to see if there's a ramp on the house. They're looking to see if there are assistive devices around, etc. Think about that it's your worst day. Not that it's your worst day, but think about the challenges a person has and describing those to the assessor. What would those challenges be? Is the person able to get up in the morning? Are they able to make breakfast? Are they able to take a shower? Are they able to get off to their day services? And if you were outside mowing the lawn and couldn't hear them, how would they get by during that morning routine? Be really honest about what supports and services they would need based on that. The assessment interprets into the level of care or the amount of budget or money that you're going to have through that year. That's why it's really important to be very honest about that. You might have a friend come with you to help remind you of some things that you might have forgotten as well. The budgets and the rates are set by the state of Minnesota currently, and information comes from the doctor, from related other team members as well, and from some historic assessments.
Hey,
Next slide,
Jerry,
please. Yes.
Jerry, I'd like to add something here too. So again, when we kind of, came up with this without any support on their worst day, because we have a lot of young adults that have disabilities that might wax and wane. And I think that's really hard. We always want to be focusing on those accomplishments, but in this case, it is a deficit-based system. So you really do have to think of those times. And again, if they're independent, half of the time, but if they don't have their checklist or whatever it is, or you need queuing for them to follow, certain types of lists so they can stay on track and be able to complete their activities of daily living, then that's, support. So you need to think through all that. It's hard sometimes for parents that are so used to doing a lot of this to really think through all the things you really do for your young adult, that if you just think if you weren't there, what would happen? And I think that's what we were pointing to. And then the other thing would also be that, again, if you have any recent assessments from your doctor on kind of, what's been happening lately, level of care, that can be really, really important to submit. They might not ask for that information, but you can always offer that. So recent reports, I tell parents, they might be seeing a psychologist or psychiatrist, and they, might not have those current records, or they haven't really summarized what's happened over the last year. It's a good idea to get those yourself, and you can choose to pass those on. I know we have a question here saying, will the assessors reach out directly to the doctors? And no, they will not unless you give them the permission. It's protected health information, so you would need to give that to them. And at Pacer, we always encourage parents to know what's in their records, to have read their records before they release them to everybody, to all the different providers, because it's just a very important right that you have.
Yes. Next slide, please. All right, so this is an example of what's given to you at the end of the assessment. You can see it's really, really comprehensive. It's has a lot of financial information, just a lot of details that identify the person, and it's meant to be consistent. So if 3 people took the assessment, their results would be different, but the questions or the approach would be as similar. There's a lot of work training that the assessors go through, at least 40 hours or more of training to become a certified assessor, and they have practice periods often for that as well. So there's a certified assessor's next step section as well. Okay, next slide, please. So the level of care. The important piece when the assessor is talking to you about services is to make an informed choice of the services. And so that's why it's important to attend trainings like this, so you can be informed ahead of time, not here the first time, but here the 3rd or 4th or 5th time, so you're aware of what's available to you. Informed choice means that you've heard about all the options, you make a voluntary decision, informed about the available options. Some common choices might be personal care tennis services, which are funded through medical assistance. They're for bathing, dressing, grooming, physical care, and mental health services, or developmental services, which are more about teaching and training life skills. Thinking about what the person qualifies for, what's in their best interest, what makes sense for them. Next slide, please. So we talked about this a little bit, informed about all the available options, funding streams, knowing where the money comes from as well. There's a menu of services under that funding stream. that you have access to getting that information, learning ahead of time. When you're offered a service, it takes some time to get it set up. So if you're learning about it ahead of time, it'll save you some time. Okay, next slide,
Jerry,
please.
I wanted to say something about that if you want to go back. So this is one of the most important concepts that we go through in our calls at Pacer Center. Again, in the terminology tip sheet, we really encourage parents, like we do in our IEP process, to learn certain basic terminology, and informed choice is one of them. You know, we want you to understand that that you should be able to get any and all options for services. We get so many calls where people will say nobody told us about all these, or, you know, they might have told us about some of them, but this is actually, you know, into the law, and so this needs to be done. So again, I think these questions too, we have questions to ask as well. So those are good things to take note of as well. That's it.
Okay. These are many of the services that we have available. I think at the first session I asked 3 questions. Where do you want to live? How will you afford rent and food? And how will you afford the staff support necessary? These are examples of the staff support necessary. We can divide these into funding streams. Some of these are paid through funding through the federal government, which is medical assistance for the most part. Some of these are paid through state funding and federal government, which is home and community-based waiver services for the most part. Some of them are paid for state funding only, which might be services like consumer support grant or family support grant, which are less common but still flexible services. So kind of going through here, PCA services on the left is the most common service. It's available to everybody based on need. There's not a waiting list. It might take some time to get them. Home care services are waivered services. Home delivered meals are waivered services. Respite's a waivered service, which means it meets a higher threshold. It's not just PCA. It's not just bathing, dressing, grooming. It's services that are over and above what PCA is. Individualized home supports with family training is an in-home service. Integrated community supports is a service we'll talk a little bit more about, which is managed by the provider in an apartment setting. Independent living skills therapy is a waivered service. There's just a number of services available. We can talk about each of these services more individually. Some services are paid through medical assistance. A common one is adult rehabilitative mental health services, ARM services. And so that is more detailed, it's more accessible, basically, because you don't need a waiver to get that. Some really interesting ones like 24-hour emergency assistance and others. So these are services you want to learn about, and so you can make an informed choice about which ones meet your child's needs the most. Next slide, please. Waiver. What is a waiver? Your neighbor might ask you, well, what is a waiver anyway? It means to waive the rules of medical assistance, to waive the rules of living in a hospital, living in a nursing home, living in an intermediate care facility. Most people want to live at home with their loved ones. And so waivers waive the rules. And waivers currently today are available all over Minnesota. Basically, if you have a waiver in one county in Minnesota, it can be transferred to other counties within Minnesota. If you move out of Minnesota, you lose the waiver, and you have to start fresh with the other state that you're moving to. States decide how to use the money. They need to manage the money by counties. The state helps to coordinate that a little bit. We can't overspend the money. Basically, we have to use what we have within the aggregates that we have, the budgets that we have as well. So remember, waivers are waiving the rules of medical assistance, waiving the rules of living in an institutional setting. Next slide, please. Mental health services, just some statistics and kind of a nice visual. I like visuals here. So 1 in 25 people with a serious and persistent mental health issue. 1 in 10 people are receiving major depression. And there's just a lot of that. If you look at the arrow on the bottom, outpatient therapy is less intense, and the state hospital is is the most intense. And so this is kind of a continuum of services. Armed services is kind of less intense. Mobile crisis a little bit more. Day treatment and partial habilitation is more. Community teams that go out and intervene in crisis situations, and residential IRTS facilities and residential crisis facilities are mental health kind of group homes, community residential settings that are available when that person needs it, and then hospitals are next. And so along that continuum are a lot of mental health services that you could be aware of and just kind of know where to go from step to step to step.
And Jerry, I just wanted to say a little bit about this. Again, this is kind of I'll see if it's a new initiative, but it is new information or, on the department's website. And I found this really encouraging. As you can see in the media, how many people are stepping forward to talk about mental health, and to reduce the stigma. So these types of communications are really awesome and helpful. Again, like you said, I like this graphic because, as people, somebody that has, been through or experienced a family member who's been, able to look at some of these services. This is a nice graphic that kind of tells you where the services fall in, as far as, again, intensity of supports, like you said, and we'll talk a little bit about a few of these in the next slides.
Okay, next slide, please. So armed services, they're easy to access. You go to your medical doctor. It's paid through medical assistance. It's an option where a staff will come to your house once or a couple times a week, and they will help the person with mental health issues with problem solving, maybe getting to an appointment, talking through their day, talking through their frustrations. It keeps people at home. The nice part is you can have other services like Wave It services, and you can have armed services in addition or on top of that. It's not a conflict of interest. The services are to instruct, to assist, to support the person with communication, medication monitoring, and education, mental health system management, etc. So it's very helpful. There's a number of providers that offer armed services. There's lists of them. You could Google them, or there's a website, minnesotahelp.info, that is a good resource to find lists of providers. Next slide.
Jerry, just one thing about that. Some people that do have co-occurring mental health with developmental disabilities may access both services, but they can't duplicate each other, correct?
That is true. You can't duplicate each other. People say, can I have a developmental disabilities and a mental health case manager? In most cases, you cannot. You have to have one or the other. If you have mental health issues, you don't qualify for developmental disability services. You might qualify for other services like a CADI waiver, but not DD services. Okay, so writing the support plan.
Yeah,
More?
I was just going to say with this one too, because we just had a question and we didn't kind of talk about it then, but again, yes, there has been a change, and yes, at your next assessment time, there will be a new process for MnChoices, with the updated MnChoices assessment, and that, again, the support plan will be one plan that will replace the community support plan that you usually used to get right after the assessment. So when Jerry showed that picture of the worksheet, that is going to now replace the CSP, and then also the CSSP. It will replace that as well. So because it's so new, and we've got some basic information, a lot of that is going to be explained before you get your assessment when they contact you. But we do have some information to get started to talk about what that's going to look like. And I've got a few details there Jerry can add in after.
Okay.
Kind of the basics here.
Sure. Writing your support plan, the plan is the guide. The plan is the map. The plan provides direction to the providers. Within the plan, there's specific information about the amount of services, the frequency, the duration, the cost, as well as who will provide the service. And the providers need to pay attention to that and follow that. There's agreed times to review the plan. Are we going to have a meeting once a year, twice a year, 4 times a year, to review the goals and outcomes and maybe redesign some of the goals and outcomes. The plan is based on person-centered service needs and informed choice that we spent quite a bit of talking about before as well. We talk about measuring outcomes, what's measurable, what's observable, how can we tell that people are making progress in a year or 6 months? And some of the words for all the documents we have changed, so we got to get used to some new vocabulary again, which is always kind of frustrating or interesting, depending on how you look at it, I guess, right? Okay, do you have more to add, Susan?
Yeah. Yeah, just a little bit again, that timing between when you get that summary sheet and when you will be working with your team to develop a person-centered focused plan, the support plan. Let's see, sorry for a second. Basically, it's just the department is saying that you're going to work with a certified assessor or a care coordinator to identify your needs and support options according to your cultural choices, preference, interests, and goals. And the support plan will outline the decisions you make about the services and supports that your young adult is eligible for. You'll receive a printed support plan that includes the information on each of the services that you choose, your provider's contact information, your case manager's contact info. There's going to be a few plans too. There's something called a health risk assessment that you will need to do if you're on managed care, but you can ask for that. Again, I'm not going to get into a lot of details. It's on our navigation chart as well, but it will outline decisions that you make to meet your healthcare goals. And it might include referrals or type of services to be provided, the frequency of support from the care coordinator, and how you contact the care coordinator. And there will also be other plans. The PCA plan will be a supplement to that as well. And PCA, again, will be replaced by the Community First Supports and Services plan. But again, we're not going to get into all that detail right now, but just to know, it's kind of like you'll have one main plan instead of the two, and then there'll be these additional kind of addendums or other plans that will feed into the main plan. At least that's what we understand here.
Okay, next slide, please. So I don't know how many years ago was it? 4, maybe 4. I always have to add 2 years for COVID, but maybe 4, maybe 5 years ago. This service became a medical assistance service versus a waivered service, housing stabilization services. It includes 3 areas: housing consultation, helping you to find and move into housing, helping you with the search and talking about the options you have; housing transition, helping you keep housing after you move in and helping you pay the rent and making sure that you're getting along with the neighbors and things are working out; and housing sustaining. A housing consultant meets with a person who doesn't have medical assistance, case management, to develop a housing-focused person-centered plan. So this is been a really, really helpful service for a lot of people because it's accessible to anybody who's open to medical assistance. It's an MA benefit that for people 18 years old or older. Sometimes there's waiting lists, which is frustrating. So if you're interested in this, it's really important to make a contact with a housing stabilization service provider as soon as possible, because there might be a list. So more information is on the website housingbenefits101.org.
And Jerry, there is a list too. And then the other thing about this that we need to clarify, which I still get a little confused on, is that, again, you don't have to have case management to do this. You are able to contact the housing stabilization provider and see if you're eligible. But somebody that's on a home and community-based waiver would use a different service under the waiver to find housing.
Right. And some counties have people, in addition to help with housing, your case manager may or may not have expertise in housing, but it really depends on your situation. So,
well, and in that case, again, because we get those calls all the time, and so there are leads in counties that are part of the Metro Housing County Group. Again, we get a lot of parents saying, my case manager doesn't know anything about housing. They really don't have a contact. Again, they should be going to their supervisor to say, who is that person in our county that has that expertise? And not to dump it all on you, Jerry, but you are a lead. So you have consulted across counties, and again, with
yeah, I'm happy help any way I can. I also know county contacts in the metro and outstate as well. So just let me know what you need. My contact information is at the end of the presentation. So next slide, please. So Moving Home Minnesota and Housing Relocation Services. Moving Home Minnesota is a federal demonstration plan. And it's been going for several years as well. It creates opportunities for people living in qualified institutions to move from their own home, from living in intermediate care facilities to moving to their own home, hospitals, nursing homes, etc. You can live in an institution for 60 days or more. Then you qualify, basically. And the place you're moving to is a person that's owned or leased by the person's family. So an apartment or a house that you bought. It's not living in some provider's home. It's living in your own home, basically. We can talk a little bit more about what own home is, that you own the home, you choose the provider, you choose your housemate, you decide what each entity is doing, who's going to pick up the medication, who's going to mow the lawn, who's going to buy the groceries, etc. A key for your own home is that you set your thermostat. You're the one that could turn the thermostat up or down. You're not going to get yelled at because you're the one that's paying for the heat or the air conditioning. Assisted living residences that provide an apartment with separate living, sleeping, bathing, and cooking areas, lockable entrance and exit doors, could be a qualified community residence as well. Assisted living is one word, assisted living plus, customized living. All these are new and older descriptions of this service. It's a residential setting is not more than for unrelated people living together. If it's more than that, then it's not considered, doesn't qualify. It's considered more of a community residential setting or group home. So.
And Jerry, my understanding is that, so for housing stabilization, I was told that, again, a housing stabilization service is not going to necessarily look for housing in group settings. It's not going to be looking for housing in community residential settings. But this service, Moving Home Minnesota, is able to do that.
Right, that's true.
And yeah. And again, a lot of this is because we have people that can't get housing that are stuck in hospitals. So we do have young adults that could potentially qualify for this. And I know sometimes the plans look a little bit different, but it's really important that you do understand that this is a service that you can access. And again, the HB 101 Minnesota is really the key to tons of information. And so you can look right on there to get the details.
And this transition services is about $3,000 that's available to help with the move and help for the services that help you move from a nursing home, hospital, intermediate care facility to your own home as well. That service is through the waiver. Okay, next slide, please. Coordinated entry. What is coordinated entry? It is, go ahead.
But I'll let you the reason why we put this in here is because we really get a ton of calls for families that need support. This isn't just one person with disability. It's a family that might be at risk of homelessness, might have a person with a disability, the adult might have a disability themselves. And so this is just really an important thing to understand for our attendees. That, again, if you want to go ahead and discuss this, but basically, go ahead.
Well, basically the continuum of care, the consistent ongoing of care includes 4 things: accessing the services, places where the individual and the family experiencing homeless can access the service, primarily related to homelessness, assessment, understanding the person's current housing and needs and risk of harm, future continued homelessness, prioritization, kind of a triage, looking at the situation, who needs really critical help immediately, who maybe has safe housing now and can wait a little bit until something else is coming up, and then referrals to specific tenants or programs or providers that might be able to help and assist based on the person's needs and preferences. So I've seen this a lot. Hennepin County has a coordinated entry system, and they use this consistently, where there's one place to call if you need a place to live and you're looking and you're homeless. And so they do all these things. They assess, they prioritize, they make referrals for that, and they have a pretty good record of serving people. In Hennepin County, some of the hotels have been purchased and they're converted into homeless shelters, long-term homeless shelters for people into their own apartments. And so that's been really a positive model that has been followed.
And Jerry, with this again, the word housing crisis versus homelessness, again, a family might be on the verge of that. And so I think the key takeaway here is that we might have individuals call for one person, right? So the child, and then you find out that the parent, this is the situation. And so are we going to tell them to go to Hennepin County's front door and do a Min Choices assessment for the child? Well, what about the parent? And what about the other child? And so really that's what this service is meant to do. And it is, it's a rule under the HEARTH Act that requires all these continuum of cares to collaborate together so they have a centralized process. I think some of the fallout of this is we might have callers say, well, I went, but I didn't get my Min Choices assessment. I got my housing temporarily, but now it's not taking care of my needs to try to get resources to go to the next phase of housing, to look for long-term housing, or it's not helping me figure out the services and supports I need for myself to get organized to know what I'm supposed to do next, because I'm an adult with a disability. So that's the thing, I think, when they go through this process, is to understand all the pieces of it, it's just like goes back to our advocacy tip sheet 101. Write down who you talk to, write down what their name is, what are their title, what is their contact, what are they supposed to do for you, and when are they supposed to get back to you? There are problems with, maybe people being gone then, and then they get turned over to somebody else. So we've gotten increased calls really for this issue here. So I just, PACER just keeps really reinforcing these basic advocacy principles, writing things down, taking those notes, doing that follow-up, not waiting all the time till somebody says they're going to call you back in 2 weeks. You put it down for at the end of the week. You need to have that persistence and know where you're at in the process.
Okay, next slide, please. So when a person turns 18 in Minnesota, they become their own guardian. There's information on guardianship available through minnesotaguardianship.org, a link on the bottom, through ARC Minnesota and through WINGS. In Minnesota also, laws changed in 2020 that the courts are looking for us to consider something called supported decision-making first before we go into full-fledged guardianship. And so there's a time-limited guardianship the first time that people are experiencing guardianship, and then they revisit it again when the person, I think it's like, I don't know how many months, they're about 30 years old. And so they have to revisit it again and say, okay, now are you, do you think you need to look at supported decision-making now, or do you want to continue with guardianship? This is a free process. Guardianship is free based on the person's income. It's something called Informa Pauperis, or IFP, so that's an important piece. If you want more information on guardianship, feel free to email me or give me a call. We have guardianship trainings available also, so just a little information on that.
And a quick note, Jerry, that I saw this on a couple of the online news groups, that Minnesota Judicial Branch did send out cards now that if you are a guardian, that you need to now file your reports through them online and set up accounts. So I know a lot of people were asking about that, but it looks like
that is true. That is true. I got a card this week too. And so when you're a guardian, you have to fill out something called a personal well-being report. You have to serve it or deliver it to the person and their immediate family. That report is now online, and you have to establish an online account, and you have to complete it every year. So that is true. All right, next slide, please. Appeals. I think that Sue should talk about appeals versus a county, but appeals are certainly an option for people. As an advocate at ARC for 8 years, I did a lot of appeals. It was really helpful for people to have their grievances addressed. There's timelines. Some of the timelines, like PCA assessments, you need to respond within 10 days, and waiver services, you need to respond within 30 days. There's a great website. If you just Google Minnesota DHS appeals, the information will come up that's probably in that complicated link that's there. You can just send a letter to Minnesota Appeals Division, St. Paul, and just say, I would like to appeal this decision. It doesn't need to be fancy. Put the person's name, their medical assistance number on it if you have it, and send that in. The county needs to give you a notice of action whenever there's a denial of service, whenever there's a reduction of service, or when they're taking too long to complete a process according to the law. And so don't not appeal because you feel you're beyond the timeline of 90 days. There could be also just reasons or just cause to appeal as well.
Jerry, I will add a few tips. We could probably have a workshop on this, but I think also, the online form is probably the easiest now. And I think, again, for parents, we always talk about when you're starting to have, whatever the issues are, we say if it's not in writing, it doesn't exist. That's Pacer's mantra across, educational services, human services, whatever. We really recommend keeping that log. Who did you talk to and when? What was the first disagreement? What have you kind of bulleted down? Who did you send this to in the organization? Did you copy the supervisor? Did you use the grievance process? So there's a lot of things you can do before you get to this point. However, we did find out this year that, again, there's really not any entity that is going to walk you through how to do this personal appeal. And correct me if I'm wrong, but we did contact the Disability Hub. They can tell you about the process, but they're not going to be able to actually help you do it. So same with the Ombudsman's office, for what I understand. Again, there might be specific caveats to that. I don't know. I just know that there was a couple of parents that were dealing with some ongoing issues that we assisted with. That's not necessarily what we do as well. However, those tips, I think some tips is that once you do file those things, you gotta be very clear about who your young adult is, all of their information, clear about what the issues are, how to just bullet those down. Like you say, it doesn't have to be fancy and in a neat legal language, but what those basic questions are. And then what I found to be helpful is that once this does get assigned to a judge, that they have their, assistants that contact you, and you can call them to really ask some of those questions. And I found them to be very helpful in walking you through some of those things you might need to do. Again, you want to have some supporting documentation to kind of prove your points. And, again, that's a whole nother workshop probably, but I think just to know that the DHS, the appeals division, people themselves have been able to, at least in some of my experiences, have been very helpful.
Right. And remember, it's based on findings of fact and conclusions of law. So have your facts in order, communicate them clearly in maybe timeline order, and that'll be helpful.
And I think that's where it comes into terminology. And that's why I really encourage and empower parents to learn terminology, because it can kind of get, murky if you're not using the right words or whatever. And again, you can always check with the case manager or, Pacer, even Disability Hub or whatever, if you have questions on that.
Okay, next slide, please. So regional resource specialists are really helpful. They're an advocate from the state of Minnesota that helps the county to implement services correctly. They are kind of the police of the state of Minnesota, if that makes sense. There's ombudsman for elderly folks, for people with developmental disability and mental health, and then your county social services director or supervisor for developmental disabilities or mental health services can be helpful as well.
And Jerry, we did get kind of clarification, at least on some of the cases that we referred parents to Regional Resource, that I think they would prefer that you go through Disability Hub first. So again, Disability Hub is the main, conduit for asking those questions. And if the people on the line don't know, they are to consult with DHS policy so they can get them to the right people. So again, that's their job to figure out who at DHS in what division that they can get your question to and get it answered and get back to you. There's also, online at DHS, you can submit questions too as the public, as a provider, whatever. But that's one way too. So they, instead of going directly now to Regional Resource, they prefer you go through that conduit.
Yeah, the Regional Resource is really a mentor for the counties, not so much for the people. Counties will contact the Regional Resource to say, what did we do wrong? Or maybe the opposite. They'll contact the county and say, hey, you need to pay attention to this. This isn't the process or the procedure for that. So.
Or in some cases, we've had it where there's just not a lot of resources in certain rural areas. So that's something like infrastructure things. So the Regional Resource has been helpful to dive in and to get, more information on that for the entire team and for the county.
Right. Okay, next slide, please. So we just have some more information about resources. Ombudsman work with quality of services, consumer safety, welfare and rights, access and referral to appropriate services, need for information and concerning services, and ideas for making services better. They're assigned by regions in the state. So if you know who your ombudsman is in your region, that can be helpful for easier access to develop a rapport with them as well. They're kind of an advocate. And so ombudsmen are really helpful to problem solve. They're involved in all nursing home closures and large community residential setting closures, as well as an advocate for the people that live there. Make sure they have the information they need. Next slide, please. Okay, you're on mute. Susan, you're on mute. Susan, you're on mute. Still on mute.
Okay, there we go. I thought I clicked it. Sorry, Brittany. We are on time. Got a few extra minutes here, and we do have quite a few questions that are piling up here. So I'm going to try, and again, I was assisting you here with the PowerPoint. So I'm going to just skim through some of these. Somebody asks, are these documents exclusive to Minnesota or typical documents in all states?
Regarding MnChoice's assessments, those are specific to Minnesota.
Right.
The assessment process is general for all states. We all have to have an assessment to determine the level of care for services and supports that we're receiving.
Yeah. So again, because the funding streams, the funding is federal, so there's home and community-based waivers in every state, medical assistance, but
There's
how that
intermediate care
looks,
facilities in every state.
right? And so, the names of those things, how your state names its home and community-based waivers, like My Choice, My Way is one that's different from Minnesota. So again, that will have its own documents, and again, for that state. So you would just want to ask that question. And let's see, it says, what is the difference between the community support plan and a MnChoice's assessment and the community support plan that my support planner will write for my son's CDCS waiver?
There's a little confusion with consumer-directed community support and the MnChoice's assessment. For a while, they had the same terms, so it was confusing. The CDCS plan itself is the plan that's at, 10 feet above the ground. The MnChoice's assessment is probably at 1,000 feet above the ground. The MnChoice's assessment is an overview, a broad overview, a broad range of of services and supports that are assessed to be eligible or needed by the person. And the CDCS plan is actually taking your budget and deciding exactly how you're going to spend it hour by hour, minute by minute, determining what the hourly rates are, determining exactly what the services will be. So it's really individualized and very detailed about how you're going to use those funds. Main choice is to assess the need, assess the budget, assess the services. CDCS plan is to implement, reading and implementing the services.
Okay, somebody is asking if they have housing on their IEP, and I don't know exactly if that's the terminology, but they're under 18. How can housing services, what service can assist them in the IEP process? So what I would say to that again is that independent living needs to be considered by the IEP team. You can say we've got many different, we could follow up with you on many different ideas of what some of those goals could look like. For instance, if you want to start to look for housing, that could be the goal. My son or daughter is looking to live outside the family home when they graduate or within the next so many years. And what are all the things that they're not going to need to do to prepare for that? It could be learning. You could have a budgeting goal. You could have just going out and starting to look at what's out there. That could be a goal. How would they do that as part of their curriculum during their, school time? You could be looking at how, again, they organize and plan things. That's going to impact their ability to be able to be independent. Cooking, cleaning, all of those things all contribute under independent living skills. So those could all be separate goals that you might have. Those are the ways, the transition to adulthood, that you would get started in knowing where your son or daughter is at, and to have them start to prepare to be moving out of the family home. If you're talking about specific, like, will they qualify for this house or not? That's going to be a little bit different, because there's going to be other processes you have to go through first, like to see if they qualify, but at age 18, you're going to be applying for certain services prior to that, which we talked about, like potentially supplemental security income, medical assistance, and those types of funding that are the gateway into housing and services.
Other questions?
Anything to add to that one, Jerry?
No, I think you did a good job.
Okay, and PACER does have workshops. And again, I was going to plug here at the end, we are having our transition mini conference coming up in May. And I think I mentioned that in the last workshop. We'll mention again at the end, or you can go on our workshops page to look at the date for that. I definitely encourage you to sign up for that. Somebody's asking about, does the parent have to be the guardian, or can the court appoint a guardian? Or maybe what is the advantage to having somebody that knows the family or they're an individual be a guardian versus having a court-appointed guardian? Jerry, anything to say about that?
Generally, you want to find your own guardian who has a relationship with the person. The court can assign a guardian, but it's going to be a stranger in most cases. That has to develop a relationship over time. So it's your best interest to try and locate a guardian or a family friend, a relative, be a co-guardian with somebody else. Just some options to think about.
And you gave the definition of developmental disability as low IQ. What's the difference between a developmental disability and an intellectual disability? I believe they are concurrent.
I think the developmental talks about occurring before age 21. So that's really the criteria for developmental disability. Brain injury, for instance, is often after age 21. Intellectual disability can be simultaneous with developmental, but developmental really tries to get to that age before 21. And the therapy is about habilitation, teaching, training, educating, mentoring, challenging the person to be as independent as possible. Developmental disability is a skill building service.
And I
primarily.
thought, I mean, I just thought it was really terminology that was just not recently. I don't know how long
Yeah,
ago they changed it. It's
yeah,
developmental and intellectual disability. They're one and the same as
they
I
are.
guess that's my
Yeah.
understanding. But
Developmental is the more classic reference. Intellectual is more current.
right. And I have a other question from somebody who's contacted me that I'm still following up with, that I do hear quite frequent, which is kind of disturbing for us. The case managers, supervisors will not help me with housing. They don't respond to me at all. What do I do?
Is that a question to me?
I'm going to
Um,
let you start.
I'm sure. I don't know. You know, people always have a supervisor, so who's their supervisor? In some counties, they have liaisons or people that work with the contracted case managers from the county level that can help and assist and oversee or try and mediate a situation. Not all case managers or supervisors are experts in housing. So I hope they would try and locate some people within their organization or some people within the county that might have more information with housing. Um, Most metro counties do have some kind of a specialist. Some of the outstate counties have regional contacts. They might have a collaboration of several counties that work together, so it's more of a regional approach.
I guess, Jerry, I understand what you're saying, and that sounds great. However, case management is a service that they have qualified for that is getting covered by a budget. They have an obligation, if they are contracted under the county, as an obligation to oversee that they do their job. Therefore, you would be going back to the county to say, this specific person is not getting back to me. Again, what I try to do, we know we have a lot of case managers and we've got a lot of turnover and we got a lot of people that, may be very new to the process. People have been pretty transparent about that. So what we always say is like, find out who that person's supervisor is and then see if you make sure that they're in the loop when you follow up with an email saying, this is what I called you about on this date. Just copying your supervisor so that we can kind of all stay in the loop. And in fact, I've seen with one agency where they actually put right in their signature line, if I'm not able to respond to you, please contact my supervisor. I thought that was wonderful. But yeah, and you would call the main line and find that out if you, to whoever's answering at that provider agency. And then if you're still having trouble, again, then you're going back to find out, like Jerry said, most of these, I mean, not all the time with the counties, but most have gone to contracted case management, which means people might not even know what that means. That means that the county goes to certain providers and they say, would you want a contract for this service? And this is what you need to do. But they ultimately are the oversight over to make sure they're doing their jobs. And some have a complaint process, so then we might say, okay, if you didn't get resolution and all those different steps, then you do need to contact the county and find out who's in charge of that provider on that contract and get a hold of them. And then usually that does it. So I don't know, Jerry.
Yeah, I think, different agencies, different counties have different processes. Hennepin has liaisons that work for Hennepin County that can intervene if needed. So it's just kind of problem solving, trying to find what the best way to the result is.
Yeah. And again, if it's not in writing, it doesn't exist. Make sure you make that paper trail and you do the email. And then you can use that as you forward it again and say, I haven't heard back from you. And that's when you can send that up the chain. So let's see. Again, the school is not any help for housing. Again, housing is a very broad topic. I'm not sure exactly what parts of the housing. We talked a little bit about how to prepare for housing. And it really does depend. Again, I'm not privy to all the different transition programs in the state of Minnesota, but we do know that we have a lot of transition teachers that do reach out to us that are part of PACER, that attend these trainings, that have some fabulous programs going, that this is part of their curriculum. So, and it's also not just that. So if they have already qualified for maybe PCA or across settings and you have county services as well, there's information that you can get from the county as well as the advocacy organizations. So I would say to that anonymous attendee to go ahead and email us here at Pacer and maybe we can clarify that question further. And some people wanted to know about wait lists, like how long are they? Again, you know, who assists to get on the wait lists? Again, the wait lists, somebody says, you know, sounds like we need to wait till we're age 18 to apply. I just want to know how long the wait is and how to get ahead as much as possible.
I think, you know, the one-page description can be helpful if you're looking at providers trying to find a housing provider. You can develop a one-page description, and that will introduce yourself to the provider and be a nice way for them to remember your loved one doing something meaningful because you included a picture on the one-page description. That might be one way to start getting on quote-unquote wait lists. It takes time to get services, but like the waiver doesn't have a wait list of 8 years like it did 6 years ago, maybe. It takes time to get an assessment, but it doesn't take years and years and years like it has in the past. It might take months, but that sounds bad, but it's an improvement over what it's been in the past.
And I would say as we get into the second part, which we're going to have to get going now because we want John to come on, is that, you know, for some of the public housing that we're going to talk about and potentially when wait lists open up, that is what we want to talk to you about tonight, how to start to get to some of those resources and get on those email lists when they will say, hey, you know, in Hennepin County, we're going to open the wait list up for housing choice vouchers. And it's going to start on this date, or we might open it up for public housing in Dakota County. You can get that, and I'm telling you, you get on there right away and you get your name on the wait list. And sometimes they're years long. Normally they are. However, they do come up. So we could talk more about that later. So with that, I want to thank Jerry. And typically we take a quick stretch break, but I do want to keep moving. This is a really packed workshop. So if you want to just kind of stand up and stretch, and we're going to go ahead and introduce John Petroskas next. Hold on 1 second here. And John, great to see you again. We always appreciate you coming back to Pacer and trying to make all this funding stuff somewhat understandable. And I do see people saying, I'm overwhelmed and I don't know if I can do all this. Again, when I first started too, I couldn't track half of this stuff. But, you know, it's just one of these, come back to it. We'll help you through it. You're not going to, you know, learn it all in one night. And so, again, just to introduce John here, he's the policy lead for general assistance in Minnesota supplemental aid in the housing division of the Minnesota Department of Human Services. He's worked on housing and homelessness for the last, it's probably not 23 anymore, right? So it's probably more like 24, 25, including 8 years on the Housing First program at Catholic Charities, helping seriously disabled men and long histories of homelessness to obtain and maintain housing. And is there anything else you wanted to add to that bio, John?
No, not at all.
Okay.
I'm going to share my screen if that's all right. I'm going to advance my slides myself. So I'm just going to take 1 second here to find that screen, and hopefully, Susan, maybe you can let me know when you see it.
Yep, I do see it now.
All right, let's get going. And I'm going to start. I just got to change the view here so you see the whole screen. There we go. So thank you, Susan. I'm going to talk, and I'm going to try to be brief in my overview of this presentation, but I'm going to talk about some housing options for people with disabilities. We're not going to cover every possible housing option that could work for your loved one. But we're going to talk just kind of generally about some of the subsidized housing programs that are out there, some Minnesota specific programs that can be used to help people with disabilities pay for housing in the community, and how you actually use some of the search tools that are out there to locate housing that might be a good fit for your loved one. So I'm going to get started with my slide here. Like I said, we're just going to do a basic overview. The two specific programs we're going to talk about are called Housing Supported Minnesota Supplemental Aid, Housing Assistance. We'll talk about those last, actually. We're going to kind of do an overview first, talk about some of the tools, and then we'll talk about these specific programs. And I'll try to give examples of places or kind of like tell you a little bit more about each of these housing options, so you can decide whether these are places, or options that you might want to pursue for your loved one or for yourself. So one thing we're not going to spend a lot of time in this presentation on is market rate housing. Market rate housing is housing that basically costs whatever people are willing to pay for it. So you're probably familiar with market rate housing. The vast majority of apartments that are for rent are market rate housing. The landlord who owns that building will charge whatever they can in that community. That could be a lot of money. It could be, affordable to somebody on disability benefits, but it's going to be driven by the market. It isn't limited in any way. The landlord will charge and can charge as much as they want, as long as they can find tenants who are willing to pay that amount. That's true also for housing that you buy. So you're probably also familiar, many of us are homeowners, right? We look at our budget, we decide, hey, you know what, here's how much I think I can afford. Here are the houses that are within my price range in the neighborhoods that I might want to live in. And that is something that if your loved one has the resources or your family has the resources to purchase housing on the open market, that's terrific, because that's a great option for some people. And then you just bring in the services that Jerry was describing and have the person live in housing that they own or that you own, and that's great. Now, realistically, that's not an option for everybody. A lot of people with disabilities who are trying to live on their own are doing it with their own income, and their own income being from the federal disability programs, SSI or RSDI. Sometimes people call it SSDI. We're not going to talk a lot about the details of those programs, but federal disability benefits, or maybe they have federal disability benefits and they're working. And so they can combine their income, but they still don't have enough to be able to get housing on the open market. Maybe they can't afford an apartment without a little bit of help. And so we're going to talk about what are some subsidized programs that help people who have limited income get into the housing world. We're not going to talk about as much about these options that basically, you're kind of on your own. If you have the money for it, great, go for it. But many people need a little bit more help. So we're going to talk about subsidized housing. And subsidized housing is basically housing where somebody is helping to reduce the rent. And there are a variety of ways to do that. There are subsidies that are kind of built into the building. Like when a person moves into a particular building, their rent is subsidized. There are subsidies that are portable. So basically a person gets like a voucher and then they take that with them, and they can use that wherever they can find an apartment with a willing landlord who can rent to them. And I don't know if you can hear, it sounds like there's a bowling alley above me. My children just got home, and so there's like thunderous sounds coming from upstairs. So we'll talk a little bit about public housing, which is public housing is housing that is owned by a public entity. Often that's called a Housing and Redevelopment Authority, or HRA, but basically it's owned by the public, and it's rented to people who are elderly or disabled, and who are very low income people. And basically the subsidy is tied to the building. You generally don't get to just go choose wherever you want to live. You get on a wait list for public housing, and you wait for an opening to occur in one of these buildings. And that wait list can be long or it can be short, depending on where you are or what kind of criteria you have to meet to get into that particular building. There is public housing that is scattered site, meaning the Public Housing Authority might own a home in a community, and it looks like every other home in the community. They happen to just own it, and the people who live there are paying rent to the Public Housing Authority instead of to a landlord or to a mortgage company. Public housing sometimes gets a bad rap. People have a picture in their head of, like, a giant skyscrapers that are, terrible quality. And in Minnesota, we're really fortunate to have very high quality public housing authorities, and they're scattered all over the state. So depending on where you live, what county you're in or what city you're in, there may be both the city and county community development agencies or public housing authorities that own this kind of housing. Generally, when you apply for public housing, you get on a single waiting list. There's like one waiting list, and basically an opening comes up and they say, okay, here's the opening we have. It's in this building. Are you interested in moving to that building? And then the person gets a chance to say yes or no. Generally, you're not on a waiting list for specific building. You're on a waiting list for any opening in the public housing system. That's a little bit different than project-based subsidized housing that is owned and operated by the federal government. So we have two agencies that own and operate a lot of housing. One is the Department of Housing and Urban Development, or HUD. The other is the United States Department of Agriculture. Surprisingly, I bet a lot of people probably don't know that the United States Department of Agriculture actually owns and operates public housing, but they do in rural areas. And I'll show you a website in a minute where we can actually look for some examples of that. If you live in greater Minnesota, USDA subsidized housing is a great option. HUD, the Federal Department of Housing and Urban Development, has two main programs for funding project-based housing. So these are buildings where everybody in the building is paying subsidized rent. Their rent is some portion of their income. It's basically based on how much income the person has. They have two big programs, the Section 811 program, which is for people with disabilities, and the Section 202 program, which is for people who are elderly. And by elderly, I mean generally over the age of 65. Sometimes you can get subsidies in those buildings a little earlier than that, but generally it's for people who are older. The thing that public housing and these site-based, project-based housing options have is that the rent is capped at 30% of your loved one's monthly income. So let's say that they are on SSI. Their only income is from SSI. They don't work at all. 30% of that annual amount divided by 12 is their monthly rent. For people on SSI, that ends up being about, right now, just a little bit less than $300 a month, which is great, because where are you going to get your own apartment for under $300 a month? You can't do it anywhere on the open market, right? You've got to find subsidized housing if you want to have rent that is affordable while you're on disability benefits. So that's one great thing about these site-based housing options. And I'll show you how do you find these and how do you apply for these in a minute. We'll get to some of the resources that people can use to actually locate housing in a second. So just file this away. We have housing where the subsidy is attached to the place. When you move into the place, you get the benefit of that subsidy. If you move out of the place, you lose the subsidy. The subsidy stays with the place. So we have site-based. There is another kind of site-based, not really subsidized housing, but it's basically reduced rent housing. And in Minnesota, we call this tax credit housing. And it's kind of complicated, but we call this low-income housing tax credit or Section 42 buildings. It's kind of a complicated process, but the state basically gives developers kind of a break on their taxes if the developer agrees for a certain number of years to make a certain number of units within a big development available to people whose incomes are a little too low to ordinarily be able to afford to live in that building. So instead of being able to charge $2,000 a month for rent, they may say, hey, we're going to have a certain number of units that are $1,000 a month as long as the person who lives there is below a certain income. That rent, let's say it's $1,000 a month, that may be much more than 30% of the person's income. As long as they're below that income level, though, that's what it takes to get into a tax credit building. There are a fair number of these buildings around. One of the things that's really tricky about these is that it is really hard to locate them because they look like every other apartment building that you might ever see, every townhome development that you might ever see. You can't look at it and say, well, okay, that's the subsidized unit right there. It doesn't work that way. They just agree, the developer agrees, or the property manager agrees that a certain number of units within this development, maybe 10% or 20% or 5%, the more that they make available, the better the tax treatment that they get, are going to be basically rented at a discount to people who are below a certain level of income. These are cool. This is a great option. Like I said, the biggest challenge is just how do you figure out where these are? There isn't one single place where you go and apply for all of these that there might be available. You generally have to locate a building, figure out who the property manager is, and go to that property manager and then apply via either their application process or their waiting list process. It's much more fragmented than the public housing or HUD way of doing things, where you apply in a single place and then you wait for an available opening. So this is kind of another place. It's tied to the unit. If you move in, you get the benefit of this discount on the rent, and if you move out, you're out of luck. That discount stays with the apartment. It doesn't go with you. There is another kind of housing subsidy, which is what we call portable subsidy. And this is sometimes called a voucher-based subsidy. The most well-known of these is the federal Section 8 program. And Section 8 is a federal program. It's run by the Federal Department of Housing and Urban Development, or HUD, and it is available nationwide. It's administered on a local level by housing and redevelopment authorities or community development agencies or public housing authorities. Public entities generally are the administrators for Section 8 vouchers. Susan mentioned before that the wait lists for Section 8 can be very long. Often the wait lists aren't even open because there are so many people on the waiting list that they don't need to open the wait list up or keep it open. They might have 1,000 people on the waiting list, and turnover available Section 8 vouchers are very limited. So that might take years to work through that waiting list. There are communities in Minnesota where the wait list moves more quickly than in others. In the Twin Cities Metro, for example, that generally the wait list for Section 8 voucher is going to be a very long very long wait list. The advantage of getting one of these vouchers, though, is that it's kind of the golden ticket in terms of subsidized housing. You basically have the freedom to take this voucher and go anywhere you want and find a willing landlord who will rent you an apartment as long as it's below a certain amount of money, and you will pay 30% of your income for that, and the Section 8 program, the federal government, will pay the remaining 70%. You get to choose where you go. So you can live in basically, you could find an apartment of your choice in the community of your choice, and it's really an awesome program. People love it, and part of the reason that there's so little turnover in the program and why the wait lists are really long is that there's when people get this voucher, the Section 8 voucher, they generally don't want to give it up. This is like gold, solid gold, because you can have so much more freedom in the kind of places that you go. The Section 8 program is not perfect by any means, but the federal government has definitely not funded the program to meet the level of need, because there are, like I said before, there are long waiting lists for Section 8 in some communities. In some communities, the waiting lists are so long that they don't even open up the waiting list. When they do have a need to add to their waiting list, they open up a competition to see how many people will even get a chance to be on the waiting list. So Minneapolis Public Housing Authority, for example, did this a few years ago. They opened up their waiting list. They said, we're going to add 2,000 people to the waiting list. They got 25,000 applications for those 2,000 spots on the waiting list, not 2,000 vouchers. 2,000 spots to wait for a voucher. So you can just imagine there's a lot of people out there who want this one. If your loved one gets this, great. This is going to give you lots of choices. It works really the same way as site-based subsidized housing, like public housing does, where your loved one is paying 30% of their income toward the rent, and then the remaining is paid by the federal government. Okay, we're going to talk about a couple of the resources. How do you connect with some of these programs? Well, one of the best places to go, in my opinion, is housinglink.org. Housinglink.org is kind of a clearinghouse of information about subsidized and affordable housing in the state of Minnesota. They have some awesome informational resources that can help you learn more about these housing resources, and they have some search tools that we'll talk about. One of the first things that I want to show you is this little screenshot here. This is HousingLink. Is the webpage up here on the top, and you could even go to this if you want while I'm talking. They have this thing called the Housing Authority waiting list. You can actually find out where there are open waiting lists for Section 8 vouchers or for public housing in the Twin Cities area. They don't do the whole state of Minnesota. They really focus, they have housing resources for the whole state, but this waiting list is really on the Twin Cities Metro. And you can say, well, you know what, I want to look at, my loved one wants to live in Dakota County. What waiting lists might be open for them in Dakota County? this webpage will tell you what's open, and it'll link you right to where you need to go. It'll also tell you where is closed, and you can sign up on this webpage for an alert. And if you're interested in applying for public housing or project-based subsidized housing, they will send you an email that says, okay, we're going to have an opening on this date for this particular housing authority. Make sure you get your application in. So this is a really great tool to use to figure out what's out there, what's open, and what isn't open in terms of waiting lists. So that's going to be for your project-based subsidized housing and for your Section 8 program. Remember that voucher-based program where you can kind of shop around and find a landlord who will rent to you. Another cool thing, I told you they have informational stuff on here. They kind of talk about the different publicly funded programs for housing. They call it the Big Three subsidized housing programs. And you can get more information about these things that I've already given you a little sampler of, as well as contact information to reach out to some of the housing and redevelopment authorities or community development agencies that run these programs, so you can get more information for the community that you're interested or your loved one is interested in living in. So this, again, this is on the housinglink.org webpage, and I think it's a really great resource to start your search there. One thing that they have on their webpage that I think also is cool is that they have a tool where you can search for kinds of housing. So let's say I just did one, I kind of dummied this up, but I wanted to search in Ramsey County. I want to find buildings for people who are seniors or disabled, and I want it to be subsidized in some way, either project-based or whatever site-based, where you're paying a percentage of your income. And it came up with a couple of different options. And some of these are places that I was familiar with, and some of them are places that I'm not familiar with. So you might notice here, there's a little thing on it. It says Section 8, no. The reason that these buildings say Section 8, no, isn't that they don't want people who are low income to live there. They have a subsidy in the building. You don't need to be on Section 8 to live in this building. This is a building, for example, that already has a subsidy in it. So you might want to take a look at this webpage, and it's a great place to try to look at what some of the basic resources are in your community. It's a great place to start. So again, this is housinglink.org. One other thing that they have is called Streams, and Streams is a way to look for housing that is subsidized or has lower than market rent, but would be otherwise difficult to find. Remember I told you that finding tax credit buildings can be really difficult? Streams is a great way to do it. HUD buildings for disabled or elderly, 202 or 811 buildings, that you can find those on here. This is a cool webpage or a cool search tool because it kind of helps you identify some of those trickier to find places. When you go to Streams, you'll find that it might seem a little less user-friendly than the other search tool. So remember kind of what I've told you about some of these things. Let's say that I wanted to search for housing, and I wanted to look for something that had project-based subsidies or public housing or tax credits. I can click the boxes right over here. You don't really need to care about these years. This doesn't matter to anybody except the people who are actually paying for the funding. But you can search for certain populations. Let's say that you're looking for housing for a loved one who has a disability. You can look for just stuff that is specific to people with disabilities. This webpage will bring up a lot of information. And I just searched here for PHAs, multifamily, tax credit buildings, and USDA housing, some of the places that we talked about before. This is the Southwest Twin Cities Metro. And you can see that there are little markers on here. And each of those markers is a different kind of housing. You'll notice that a lot of them are in Minneapolis. A lot of them are these orange buildings. I can't remember which the orange and the purple are, but basically you can click on each of these little dots and it'll tell you about the specific building. So I'll give you a snapshot on the next page of what that looks like. I clicked on this purple one. It is for the Bluffs at 9 Mile Creek and Eden Prairie. It says how many units do they have that are affordable to people, and it gives you contact information. Well, this one doesn't give you contact information, but you notice here it says 42. That's section 42. That means it's a tax credit building. So remember, units in this building, they're not subsidized. They're going to be cheaper than the market rate if your loved one qualifies for them. So it looks like this building has a lot of 1 and 2 bedroom units, and it doesn't mean that they're vacant. It just means that's how many are maybe in that particular property. Then you get a hold of the property management company and find out what it takes to apply for that particular building or project. Okay, one other thing that I want to show you is for how do you find congregate housing places. We're going to talk in a minute about the housing support program. And housing support is a state funding source that people use to pay for congregate housing. And I'll talk a little bit about what that means in a minute. You might have heard people talk about group homes or foster care settings. There are both corporate adult foster care where it's run by a company, or family adult foster care where it's a home that's run by an individual. And they are generally small, 1 to 4 people per building or per home. And it can be difficult sometimes to figure out where these things are, because a lot of these congregate settings that are funded through housing support are integrated into the communities, which is one of their strengths, really. It's that they let people, they give people opportunities to live integrated into the community. You cannot pick out one of these houses, just by driving down the street and looking at it. They are just like every other house. They just happen to be shared accommodations, generally with some services on site through either a company or an individual who owns the place. So I'm going to stop sharing my screen for a second, and I want to go actually to HB 101. And I'm going to show you how this actually looks. So here is the web page that you want to go to. It is mn.hb101.org. Housing Benefits 101. There are Housing Benefits 101 sites for other states. We're going to find the one for Minnesota, because that's where we are, right? We're looking at Housing Benefits 101 for Minnesota. The thing that you want to look for on this page, if you're looking for congregate housing opportunities for your loved one, you want to look for this thing right here in the middle called Places. Do you see the little orange place marker like you'd find on one of your computer maps? There's also a link to it right down here underneath the top. So HB 101 Places. We're going to click on this real quick, and I just want to show you a brief example of how this works. Let's hope it opens up. It is opening up. Okay. One thing that I think is cool about this is you are going to search in Minnesota here, and you can just do it by zooming in on a particular community, or you can do it by putting together some parameters on the side here. You can say, well, okay, I want to do it for a certain distance from this particular zip code. I want to see the places that have vacancies. Or maybe you don't. Maybe you're just kind of feeling out what's the market out there. Maybe I want to talk to a particular provider, even if they don't have vacancies right now. Maybe I want to narrow it down to places that are just for young adults. Let's say that I want to do that. I'm going to click that box right here, because I am looking for, in my imaginary search, I'm looking for a place for somebody who's 21. And I want to search for a place that has services for someone who has a developmental disability. Okay, now the list that it has generated is relatively modest, but very helpful. You can look at who the providers are, where the place is. It doesn't give you necessarily a street address, but it's going to tell you what community it's in. Okay, well, we know we have a couple openings in Red Wing, and it tells us a little bit about who that particular program serves. Lutheran Social Services, Eagles Nest, this is for young adults. It's going to be people who have brain injuries, developmental disabilities, FAS. And it will serve people who have a particular waiver, either the CADDY waiver or the DD waiver. This is enormously helpful information to have, right? Even if they don't have a vacancy, you might say, wow, that sounds perfect for my young one. Then you want to look and say, well, how is this paid for? Either your loved one is going to be on the housing support program, what we sometimes call the group residential housing or GRH program, or you can pay for it on your own, or your loved one can pay for it on their own. And we'll talk about how that works. But this HB 101 Places is really cool. It brings together a lot of information about real-time vacancies in one place, and I think it's a really great resource. I also wanted to show you real quick, there is a way to search for USDA housing, and this is a web page that you're going to have to Google this one, because the way you get to it's a little complicated. But the United States Department of Agriculture Rural Development has a web page where you can search for multifamily housing rentals by state. And let's just click on it for Minnesota, and it will take you to, drum roll, while we're waiting. Okay, it takes you to a map of counties. Let's say that I want to look for USDA rural housing, and I want to live, or my loved one wants to live in Beltrami County up in Bemidji. This will tell you the names of the programs or buildings up in Bemidji that are subsidized. And let's say I want to click on one of these because I'm interested in Ridgeway Court. So I click on that and it will take me directly to a place, shows me a picture of the building, how many units are there, what kind of subsidies do they have, who's the manager, who can I reach out to directly and figure out how to get on the waiting list for this building. This is kind of cool that you can drill down really quickly and figure out, in greater Minnesota at least, what options are out there. So I think this is something really cool. And if I think of it, I'll put the link. I don't know that I can actually put the link in the chat because the chat I have is different than the chat you guys have. But anyway, we'll post this later, so don't worry about that. Now I'm going to go back to my slides. Okay, I got to catch up to where I was before. Let's talk for a second now. I've mentioned this program already. I want to tell you a little bit more about the Housing Support Program. This is one of the programs that we run at the Department of Human Services. This is a Minnesota-specific program for people with disabilities or people who are elderly, and it is a really cool way to pay for housing when a person doesn't have enough income to afford the kind of congregate housing that they might need to live out in the community. We'll talk about how it actually works in a minute. We're also going to talk about the Minnesota Supplemental Aid Program, or MSA, which is one of the programs I'm responsible for at the state. There is a component of the MSA program called housing assistance. It is very different than the other kind of housing programs we've talked about so far. It basically gives a person more money and allows them to use that money to choose this kind of housing that they want in the community. And we'll talk about how you actually get this too. Okay, first things first, you got to know that to get housing support or Minnesota supplemental aid, you have to apply for it. And there are basically two ways to apply for this kind of help. You can do it online, or you can do it the old-fashioned way by calling or visiting your county agency and filling out a paper application. If you get these slides, they're on like they got posted by Pacer, so you can actually go to the slide and you can click on this, but I also put the link here as well. MN Benefits, or MN Benefits, is our new online application process, and you can apply for public assistance programs online in a very fast and easy kind of web portal, which I think is really cool. Or if you're more comfortable filling out a paper application, that's still an option too. We have something called the combined application form. I'll show you a picture of it here in a minute. Like everything at DHS, we put a number on it, and the form number for that is the DHS 5223. There's a link to it here. You can also search on the Google thing and find the combined application form for Minnesota. It'll take you to a DHS webpage. If you ever get directed to something that isn't a Minnesota Department of Human Services webpage, don't fill it out because it could be phishing for your information. You want to make sure you're going to the MN Benefits webpage or using the online portal to find our forms. And you can actually fill the form out online. You just can't send it. You have to fill it out and then either print it and mail it, fax it, bring it in person, put it in a Dropbox, or you can take your loved one to the Human Services office in your county and you can actually just get the paper application handed to you, fill it out, and then give it back to them. So there's a couple different options. I want to show you what MN Benefits looks like. And that is, like I said, oops, I need to go to the reading view. I'm sorry. Get back where I meant to be. I meant to be looking at this slide, not the other version of this. mnbenefits.mn.gov. This is the online portal to apply for public assistance in Minnesota. Not every program is available this way, but many programs are. The ones that aren't available are things like the state's healthcare programs. They have a whole separate way of applying for those. This is for what we would consider cash assistance or the housing program, housing support, or for food support, the federal SNAP program, Supplemental Nutrition Assistance Program, which is a really cool program that helps people pay for food, or childcare assistance. You can apply for any of these using the MN Benefits webpage. You can do this on your phone. You can do it on a computer, doesn't matter. It's optimized to do on a phone. It's one of the few things at DHS that has actually kept up with the times, but it is really slick if you do it on your phone. Probably all told, this application will take you about 15 to 20 minutes. Some people can do it faster with practice. But basically, when you start on the MN Benefits application, it asks you, what do you want help with? A lot of people just click all the boxes because they don't know, and that's okay. You can totally do that. But it is sometimes helpful to focus on what you really need help with. Maybe your family member needs cash, like the Minnesota Supplemental Aid Program that I talked about a second ago. Click the cash box. Maybe you know that your loved one needs congregate housing and they want to pay for it through the housing support program. Click the housing support box. Super slick. It'll ask you for some information. Fill out the application with all the questions that it asks. Click submit. and it automatically gets sent to the county where your loved one lives, and then they will process that, reach out to you or to your loved one to complete an application, and they will tell you if there's anything missing from your application. Maybe there's some proof that you need to supply. Maybe if you say, you know, I want to apply for MSA housing assistance, they're going to need to see a copy of your lease so they know what your housing expenses are. Sometimes there's more, you know, different kind of forms and paperwork that we need to get from you in order to make a decision about whether or not you're eligible. But this is how it starts, is with this online application. Now, like I said, you can do it the old-fashioned way. Maybe you're an old-fashioned kind of person. You want a pen and a paper kind of thing. You want to write it down, have a copy of it for yourself. You can do this way. So this is what that combined application form looks like. That, remember, the form number is DHS 5223. You want to fill out in the middle right here, just indicate which programs you're interested in. Make sure your loved one or you sign the bottom of it and date it. And that's what it takes to get your application started. I forgot to mention that one cool thing about this online application is that when you're done with it, it will mail you a copy of what you filled out. So you have a PDF of the application that is going to the county. What you filled out online gets turned into this. And this is what gets sent to the county agency. And this is what you will get a copy of in your email after you finish doing the MN Benefits online application. So you'll have proof that you applied on this certain date. They'll give you a confirmation number, and then you have that for your records, which I think is pretty awesome. Okay, let's talk about the Housing Support Program. This used to be called the Group Residential Housing Program, or GRH, and that's still the word that a lot of people use when they're talking about it. They changed the name a couple years ago to Housing Support, which is fine, but it's such a bland and not descriptive name that a lot of people don't really understand that it's a specific program. They think, oh, housing support, well, I need that. No, this is a very specific program for a very specific purpose. It is used to pay for room and board costs in licensed or registered settings. So you can't just take GRH and pay for an apartment. You have to go someplace that has a DHS or a Department of Health license or registration. Typically, that's going to be an adult foster care setting or a board and lodge facility. There are a variety of these in Minnesota, and we'll talk more about these in a minute. But the kind of thing that you might be familiar with is group homes. People use the word group home. It's not really a thing. A group home, what they're generally talking about is a adult foster care setting that is paid for using the housing support program. Group homes can be funded other ways, but this is, in Minnesota at least, the predominant way that group homes, in quotation marks, are paid for. They are called adult foster care settings, and they are paid for with the housing support program. There are other things that housing support can be used for. We're really not going to focus on those because they're generally not for the mainstream population. There are some ways we can use housing support in different creative ways for certain populations, specifically people who have experienced long histories of homelessness. We're not really going to focus on those folks right now. To be eligible for housing support, generally, there are two ways to do it. Either you have no income whatsoever and you're eligible for the program because you have no other way to pay for this specific sort of housing that you need, or you are receiving disability benefits from the federal government. And there are two flavors of that generally. There is the SSI program, the Supplemental Security Income Program, or there is the RSDI program, sometimes called the SSDI program. I prefer to call it the RSDI program because I'm old. It stands for the Retirement Survivors and Disability Insurance Program. These are two federal programs for people with disabilities who require an income income from the federal government to live. People can get one or the other or both. There is no it doesn't happen very often, but there are people who actually qualify for both programs at the same time. It's kind of a weird situation. We don't need to get into it a whole lot. But basically, if your loved one is receiving SSI benefits or receiving RSDI benefits, they qualify, in quotation marks, for the housing support program. It doesn't mean they're guaranteed to get it. It just means that that's like the eligibility threshold that they have met. They also have to have limited assets. We're not going to worry about that. Generally, people who are on SSI and RSDI don't have a lot of assets. They're poorer people. Housing support works in a kind of a complicated way to explain, and I'm going to do my very best. Picture a bucket, and that bucket, DHS, the Department of Human Services, says to live in one of these congregate settings, like a housing support setting, that bucket needs to be filled with a certain amount of money. And that amount of money is how much the housing support provider can charge a person to live there. That bucket right now has to be filled with $1,135 a month. Your loved one will put most of their income into that bucket. And imagine that that income fills the bucket up about halfway. The remaining part, the rest of the bucket, is filled up with money from the state. That's the housing support benefit. That amount of money, combined with the money that your loved one puts into the bucket, gets paid to a provider. And that provider gives your loved one a place to live, 3 meals a day, housekeeping, and in many cases, they provide some of the services that the person needs to live on their own. You can imagine that a person who has more than $1,135 a month in income, when they put their income into the bucket, there's no room left at the top, right? That person is over income for the housing support program. It doesn't mean they can't live in a housing support setting like a group home or adult foster care. They absolutely can. They will just have to pay for it all themselves. This housing support program fills the bucket for somebody whose income doesn't fill it up on their own. And that's kind of what this little graphic, very elegant graphic. I think I'll say so myself, this beautiful graphic. It's why I work for the state and I am not an ad man or graphic designer. You can imagine how badly that would go. Here's how it works. A friend at work helped me put this one together. For a person who wants to live in an adult foster care setting, let's take the example of somebody who's on federal SSI. Their only income is from the SSI program, which currently provides them with $943 a month. They get to keep $125 from that money, and that is called their personal needs allowance. They keep that money so that they can pay for things that they need. The rest of their money, $818, goes to their provider. Now, remember, we have to fill the bucket up with $1,135, right? $818 is less than that. So the state steps in and they pay the remaining $317. So $317 from the state, $818 from your loved one. That totals up to $1,135. That goes to the provider, and the provider provides them with a place to live and the value of their meals in the course of a month, plus linens, laundry, housekeeping, lavatory supplies. They take care of the place. They pay the utilities. They pay for the cable, whatever, is in there. Everything has to be provided for your loved one, except for personal items like, maybe a couple of hygiene items or, cell phone or something that the person wants, or maybe they want to have some money to go out and do some activities, recreation, treats, ride the bus, whatever. They can spend the money on their on clothing that they need. But basically, this is how it works. The person pays part of their income, a large part of their income, and the state pays the remainder. And the person is then provided with everything that they need to live a quality life in the community. Okay, I'm going to skip past this, except I want to mention one thing. Your loved one, let's say that they want to move into a housing support setting, and then they decide, hey, I'd like to get a job. That's great. Some of the money that they earn from their job, they will get to keep. And some of the money that they earn from their job will have to go to the provider. It's too complicated to explain exactly how it's calculated. We don't need to worry about that. Just know that some of the money that they make goes to the provider. They get to keep actually a fair portion of that money that they earn from work. But it is possible that a person who goes to work can earn enough that they no longer need the housing support program. They basically have worked their way off of that program. They can absolutely stay in that housing support setting. They don't have to move. They just have to pay the total $1,135 on their own. They don't get help from the state anymore because they now have income sufficient to fill that bucket up to overflowing. Okay, I want to put in a plug for a really great webpage, MNDB 101. Remember we talked about HB 101 before? We had a couple, or actually, yes, we did, because Places is on there. This is Disability Benefits 101, and it's kind of a central like clearinghouse of information about public benefits. They have some really cool estimators on here. If your loved one is on SSI and thinking about going back to work, or maybe they just got a job and they want to see how is this going to change my benefits, you can actually kind of use these calculators that are on this webpage to figure out exactly what it will do to your income. And this can help a person decide, I would like to pursue that job opportunity. Or they might say, oh, this isn't going to really be worth it for the amount of money that I'm going to make. It's not worth it to me. It's totally just a tool that your loved one can use to figure out, or you can use with your loved one to figure out the benefits of going to work. Now, another thing that I want to plug is that it can, going back to work, can have an impact on the person's health benefits. They might qualify for different programs. If they have some earnings, they can use that their wages to pay basically for their own health insurance through the MAEPD program, which is pretty cool. And that's something that your loved one can learn more about on this DB101 webpage. So check it out. It's a really neat webpage. Another really awesome thing that I want to put in a plug for is the very hands-on benefits counseling that is provided by Goodwill Easter Seals. They have a program called the Work Incentives Connection, which is funded by the Federal Social Security Administration. The same people that give out SSI and RSDI benefits to people with disabilities have a grant that goes out to agencies like Goodwill that help people understand how to get back to work, because we know that a lot of people who are on disability benefits do want and are able to work maybe in a more limited capacity and want to do that, but they need to understand the impact of work on their benefits. The Work Incentives Connection provides one-on-one individualized counseling so people can figure out exactly, here's all the benefits I'm on, here's exactly how work will affect all those benefits. And they are so great. And I really, really encourage you to check it out if you've got a loved one who is on Social Security and is interested in work. They will take the time that they need to explain it to you. They do a really, really great job. So put in a plug for Goodwill's Work Incentives Connection program. Now I want to talk last about the Minnesota Supplemental Aid program. And I have just a few minutes to finish up, so I'm going to do this. Minnesota Supplemental Aid is a program that provides a little bit of cash assistance to people who receive federal disability benefits, either through the SSI program, Supplemental Security Income, or the RSDI program. They can get MSA if they're not receiving SSI, but if their income is only from the RSDI program, it has to be fairly low. So we'll talk a little bit about what that means in just a minute. To be eligible for Minnesota Supplemental Aid for this little bit of additional cash, you have to be over the age of 18 and receive SSI, or you would be receiving SSI, except you get money from another source. And typically that's going to be from the RSDI program. So far, this is a big group of people, right? There's lots of people who are out there who are over 18 and receiving SSI and could use a couple extra dollars each month. Awesome. What we generally give people who live in the community is $81 a month, which is a pretty modest amount of money, but it's still $1,000 a year. And if you think about that, that's like basically getting one extra Social Security payment each year, which is big, right? I mean, for people who are on SSI and only getting $943 a month, $81 is not a drop in the bucket. It's actually pretty awesome. We can also provide people with a little bit of extra help if they have certain what we call special needs. One of those special needs is if they have a representative payee. Let's say that they can't manage their money on their own. Somebody manages it for them, a professional, I should say, not a family member, and that person charges them a fee. We can pay that whole fee for them, which is pretty cool, up to $54 a month. If your loved one has a guardian and conservator and they pay a fee for that service, we can pay up to $100 a month for that fee. So these are just some examples of extra things that we can provide. Another extra thing that we can provide through MSA is money to help pay for a special diet. If your loved one has a particular special diet, it's going to cost them extra money to follow that diet. We can pay for that special diet. It's important to remember that only certain special diets are covered. This isn't really the point of this presentation, but the diets that are covered are not everything you can possibly think of. There are certain diets that are covered and everything else isn't. But basically you need to get a form from your county, take it to your loved one's doctor. The doctor fills it out and says, I think your loved one would benefit from a such and such diet. We can give that person a little bit of extra money to help them pay for that diet. The last special need program that we have through Minnesota Supplemental Aid that helps people is the Minnesota Supplemental Assistant, or MSA, Minnesota Supplemental Aid Housing Assistance Program. We're going to talk a little bit more about that on the next slide. The way that you let the county agency know that you're interested in these programs is by finishing the application. There's a question on the application. that asks if your loved one has any of these particular needs. You check yes. Our online application, unfortunately, does not have this question yet. And so you would have to indicate at the end of that application that you're interested in these extra programs, or when they call you to talk to you about the application, you can tell the financial worker from the county, hey, I heard about this special diet program or this housing assistance program. I think my loved one might be eligible for this. Can you tell me more? And then they'll send you the paperwork that you need in order to identify whether you're eligible or not. So who is eligible for MSA housing assistance? Well, first of all, you've got to be eligible for MSA. So again, remember, you're over the age of 18, you're on SSI because you have a disability or you're blind or elderly, or you would be on SSI except you get income from another source, and that typically is going to be from the RSDI program. You got to be under the age of 65 when you apply for this assistance. You can continue to receive it after you're 65. You just have to start before you're 65. And third, you have to have housing expenses that exceed 40% of your gross monthly income. Right off the top, I need to make one thing super clear. This program is not for people whose rent is subsidized. If they live in public housing, if they live in HUD subsidized housing, USDA subsidized housing, they're on the Section 8 program, they get a voucher from another state agency that limits their rent to 30% of their income, they are categorically not eligible for this program. But that's fine because they're already getting a really good rental subsidy and they have a good deal. This is for people who aren't in subsidized housing. Let's say that your loved one is on SSI, they're 50 years old, and their rent is $800 a month. They have very little money left over at the end of the month after they pay their rent. Maybe they have utilities to pay and they have nothing left at the end of the month. They are potentially a perfect person to apply for MSA housing assistance. And oh, I wish it was true that these were the only eligibility criteria, but unfortunately they're not. This is just the front door. What you also have to do is be either relocating to the community from an institution, have a PCA, be on a waiver, or be transitioning from the housing support program. I'm going to talk a little bit more about each of these in detail. Relocating to the community from an institution, we don't see a lot of this anymore. There used to be people who were stuck in hospitals for 6 months to a year, because they couldn't find housing in the community. This program was kind of designed to give them a way to get out of those institutional settings. But it's possible that you might have a loved one who meets one of these criteria. Maybe they were in a nursing facility, maybe they've been in a hospital, maybe they were in an ICFDD, like Jerry talked about, intermediate care facility for people with developmental disabilities, and they're leaving one of those places. They're moving out into the community. Cool. If they meet all the things on that prior slide right here, and they're relocating to the community, they might be eligible for MSA housing assistance. Let's say that they're on a waiver. This is the other big way that people qualify. And I'm thinking about, a lot of you in the audience, you have maybe a child with a disability and they are already on a waiver, or they will be on a waiver if you go through that process that Jerry described of going through the MnChoices assessment, and they're determined eligible for a CADI waiver, a DD waiver, a traumatic brain injury waiver. There's lots of waivers out there. Doesn't matter for our purposes what waiver your loved one is on, they just have to be on it. They can't be on the waiting list for it. They can't be have been on it and closed it or turned it down. They have to actually be receiving waivered services. Or let's say that they are moving out of a housing support setting. Imagine your loved one was on let's just pick an example. They were on the developmental disabilities waiver, living in a group home, and they have the ability to live in the community and the desire to live in the community on their own. Or maybe they want to have a roommate. Maybe they've met somebody at the group home that they really liked and they want to move out and have their own apartment. They can use MSA housing assistance to do that. They're leaving a housing support setting and they're moving into the community. Let's say you've got a loved one who meets these criteria. Well, what happens? What's the big deal about MSA housing assistance? Here is the big deal: is we give you a whole bunch more money to work with. Let's take the example of your loved one who gets SSI, $943 a month. They get $81 in MSA cash assistance that they can use however they want, and they get MSA housing assistance, which is half of the SSI rate, half of the 943. And you might be doing the math in your head and say, John, that's not half of it. Well, it isn't exactly half. It's because there's a little bit of lag time in the way that we calculate the MSA housing assistance benefit. Today, it is half of what SSI was last year. July 1st of this year, it will be half of what it is now. I know that doesn't make any sense. I don't know why it changes on July 1st instead of January 1st when the SSI amount does, but that's just how it works. Today, if your loved one qualified for this program, they would get this additional $457 a month. On July 1st, it's going to go up to half of $943, which is $471.50. So it's going to go up $14.50 on July 1st. Point is, they suddenly have a whole bunch more money to work with. $1,481 a month in this example. One thing to remember is that when they get this money, they get to choose how to use it. So let's take the example I gave you before. Your loved one's on SSI, they're paying $800 a month. Your loved one can choose to stay in their $800 a month apartment, and now they just have a lot more money left over at the end of the month. They can choose to move to a bigger apartment. Maybe they go someplace that's $1,200 a month. Maybe they move to a different part of town. Maybe they say, oh, I don't want a roommate anymore. I want to live alone. Now they can do that, right? Maybe they don't want to live in a studio apartment or a rented room anymore. Maybe they want a 1-bedroom. This gives them the tool to do it. So this is really an opportunity to exercise more autonomy and choice in selecting the kind of housing that you or your loved one wants in the community. This is a tool to provide for better integration of people with disabilities into the community by giving them the money that they need to pay for housing, which has rapidly outpaced the amount that they get on SSI benefits. So one caveat I want to say, if your loved one is on SNAP, the Federal Food Assistance Program, when MSA goes up, SNAP goes down. And this can be very frustrating, but I like to think of it as a teeter-totter. When we put more money on one end of the teeter-totter, the other end of the teeter-totter gets lighter, right? It has to get lighter. So it's very difficult to predict exactly how much they will lose in their SNAP or whether they'll lose it at all. SNAP is a complicated program, and it's difficult to say, here's exactly what's going to happen. But you should be aware that when we put more money on the MSA side of things, sometimes the SNAP side of things ends up lighter. They will always be better off with MSA, but they will lose some SNAP along the way. Just want to put that out there. Okay, so how does this work? Like I said before, you've got your loved one who's got $943 from the SSI program. They get this additional money from MSA. Their total income is almost $1,500 a month. They can live wherever they want as long as it costs less than $1,481 a month, right? And then they can choose how much they want to have left over at the end of the month by having a more or less expensive place to live. But there's no provider. In the housing support program, remember how all that money flowed to the provider, not to the person? Here it flows to the person, and they get to decide, and then they pay their rent on their own. There's nobody paying the rent for them. They're totally on their own. All right, that is all I have to say. I do want to talk briefly. Susan asked me to put in a slide about the Crisis Housing Assistance Program. If you have a loved one who is receiving substance abuse disorder treatment or psychiatric treatment for 90 days or less, and they are living in the community, they have rent to pay, this Crisis Housing Assistance Program can pay their rent while they are getting the treatment services that they need. This is a way to keep them from losing their housing while they are getting important services. It is administered by the ARC of Minnesota. It's been through a bunch of different administrators. It is with the ARC of Minnesota now, and hopefully will be for a long time. You can apply for it online at the ARCMN's webpage, or you can give them a call. And this Crisis Housing Assistance Program, I have used it with clients that I work with. It is really great for them to be able to go and really focus on their treatment and not worry about maintaining their housing in the community. So super good resource to remember that they have. And Susan also wanted me to put up here ABLE accounts real quick. ABLE accounts is a national option for people who are disabled before the age of 26 to save money either themselves or through family members that they can use for a variety of disability related expenses. This is kind of like a 529 plan. If you have a 529 plan, maybe for one of your kids who wants to go to college, this is kind of an alternative like to the 529 plan. It's just really focused on people with disabilities who might need resources for things that are important to them, and this gives them a tool to do it. And the really critically important thing about the ABLE accounts is that this is not counted as a resource when it comes to determining eligibility for public benefits, including federal SSI benefits. This isn't an asset that is counted, so your loved one can have money in an ABLE account and still receive the SSI benefits. Back before ABLE accounts, if you tried to save money while you're on SSI, you would very quickly find your SSI terminated because you would go over the very, very low asset limit for that program. So this is a way for people to save money, or families to save money for their loved ones who have disabilities. Okay, Contact information for me is here. We are almost out of time. I'm sorry that I have had to talk so fast. I know this is a ton of information like a fire hose. Please feel free to reach out to me. If you have questions about any of this, I know I went very quickly. I will also stick around to answer questions. And I think Susan has some slides that she wanted to talk about before we're done. So I'm going to stop sharing my screen if I can here. Okay, Susan, I got to figure out how to stop sharing my screen. Hold on.
That's okay. While you're doing that, John, I'll just mention actually these two slides, you've already covered the HB 101. And, you know, we mentioned it in the first workshop. So I think because we want to get to some of the questions here, we can also go over that in the third workshop. And the other slide was on locating services, which again, we can go through in the next workshop. Jamie, are you able to
John,
get?
I think I was able to just stop your
yes.
sharing. It looks like I'm now taken over.
You
Yes.
did. Thank you, Jamie.
Okay,
I appreciate that.
Okay, yeah. Yeah, so this is the housing benefits 101 I was talking about. So we will cover this next. The only thing I'm just going to point to super quick, you want to go to the next slide, Jamie? Is that on the front page now, up here, do you see this housing guide for young people here? It's on the very right. This is a new site that DHS has developed for your young adults right at that age. And there's tools on how to get started. There's helpful videos, there's forms, there's the vault that you can keep your information. And so again, why don't you start to explore that? People want to know how to get started. This is one of the first ways, as well as our workshop here. So you can go ahead and go to the next slide, Jamie. And then that we'll cover this next one on how to find services as well. Go to the next slide, Jamie. So just let's go ahead and take some of the questions and then we'll wind it up here with the last slide and some of the resources. But the main question is, John, and you know what? I'm pretty sure I'm right on this because we actually called HUD some time ago. When can you get your son or daughter on the HUD list? So say on to apply for housing vouchers or for public housing, that's age 18, correct?
Yes, that's correct. Age 18, because if your loved one got to the top of the list and got one of those, they would not be legally capable of signing a lease.
Okay, then that's it. Yeah.
So they have to have reached the age of majority.
Right. So everybody's getting kind of mixed up because we're talking about wait lists for this and wait lists and when do I get on the wait list? Well, there's different types of wait lists as it applies to different parts of that process. So for example, for the services, again, if you're looking at getting services in your own home now, you can apply for those if you need them and go through the Min Choices assessment. But then when you're ready to move out and you have your own place and you know where that might want to be, then you talk to usually your county case manager and then you're applying then. And I guess, you know, the actual logistics of that, John, are you know, I guess I'm trying to remember what we did exactly. Did I go on there and apply myself? I might have done that. Are they going out to fill out the CAF form and all that stuff themselves, or the case managers? I mean, you might not know that, but
well, public benefits can be done, you know, the application that I talked about, the MN benefits or the CAF, can be filled out either by your loved one or by you as their authorized representative. And I always think it's a good idea for your loved one to have an authorized representative. That's a person who can talk to the county on your loved one's behalf, receive copies of notices, fill out paperwork for them. If they get SNAP benefits, you can even get your own EBT card to actually go grocery shop with that person or for that person, which can be convenient. So I think an authorized representative would be the person that you're thinking of. And that could be anybody that your loved one chooses.
Okay. And again,
generally will not be the case manager, I should say, who's going to be spending the money, getting the EBT card. Most places won't let them do that. But I know when I was working in direct service, I was the authorized representative for many of my clients, so I could get copies of their notices. That way, if they didn't turn something in, I would know they were going to get cut off and I could help them out before they did.
Right. And so many times, again, that's the authorized rep, which can be separate from the guardian, because so that's, you know, part of that workshop is on that specific, the differences between those two things. But for people that are their own guardians and still need the help from a parent, you might have that person put in writing, I want my parent or these people to assist me, and they do have permission, my permission to be able to access my information to help me with the information. We've advised on that. But again, we're not attorneys. So that's just something that we've run into with people that are in the process of, maybe having a guardian and or needing that assistance. So there's a question here about, is there a minimum number of hours a candidate has to work to qualify for 30% of income for rent? I don't know if that's a calculation.
No, there are some rules in public housing about people being productive or being like in job search or volunteering in the community. But for people with disabilities, that requirement is waived. So it probably wouldn't affect anybody. There is no requirement that people in public housing work a certain number of hours. If they have a disability, they are exempt from those special requirements.
Okay. And let's see here. I know we just had somebody ask about, is there Section 42 housing? And I just said, yes, there is. And in fact, at least some of our experience has been that affordable housing builders are, applying for that for people. And you'd be surprised, I think, in some of the research that we've done to see that many of the new developments or things that are going up around you have those units available, but you would never know unless you went on that Housing Link Streams or found out where they are. Again, like you said, they might not be available, but I know when I was doing some of our own personal research, I was really surprised to see some of the luxury apartments. And we even have our next story. We're going to feature a group of parents that approached a developer on Section 42 tax credits. And it's a great, like you said, way for young adults to be able to afford their apartments if they meet that criteria. So I don't know how much of it is there, but it is at least that's kind of what we've found. I don't know, John, if you have any other comments about Section 42.
No, just that the state has invested a lot of money through tax credits to making those below market rate rents available to people. And the challenge, like I said in my slides, is to just figure out where those options are because it's not obvious.
Yeah, and I really think what everybody's saying, what can I do to get started? I'm going to say, as somebody that's kind of had to go through this with my own son, you can get started looking now. There's nothing that says you can't start to look on these search engines. I think that's a great place to start. I, am a homeowner and I hadn't been out there looking for apartments, and it was a shock that I just wasn't aware of them, or my son wasn't aware of them. And you got to just become aware of what's in your community or where you may want to live. Again, it might not be there, and start to go on and look at some of the places and check it out. You can call the landlord to say, I see you have 10 of these units available, and what's the wait list like? You can get your name on the wait list and they come up. You'd be surprised. But then, as I said, you need to be prepared to have the services ready to go. And that's where the challenge really comes in, is to get the landlord says, okay, we got all these people behind you and we're ready to have you apply. Are you ready to go? And then, you've got to have your staff there if you're going to need that. And some parents have had to, or the timing of that, can be kind of complex, but there have been ways parents have navigated that. So I think that's a wonderful way to get started and to really see what's out there. John, let's see, what else do we have here? And somebody did ask, let's see. Yeah, we actually already talked about that. I'm sorry. And well, that's another one we talked about too. Sorry. Let's see. Somebody did share the U.S. Rural site, which is great. We actually, one of our stories in 2021, we featured a young man who's in one of those sites. And so I can point you to that as well. Yes, I saw that. Oh, you've already answered a few of these, John, I saw. Okay, I'm just skimming down here, sorry.
Yeah, a couple where I could type a quick answer, I did. So
yeah, yep.
Things are off the queue.
Yeah. Let's see here. Sorry, I'm kind of going backwards again. again, somebody did ask about, and that kind of gets into the special needs trusts. If somebody's dad just passed away and was a beneficiary of a small life insurance policy, will this affect his ability to apply for supports? Now they can, again, if it's not going into a trust or something for Social Security, it can affect, because Social Security looks back, I don't know how many years. Is it 2? I don't know how many. Again, we have an SSI person at Pacer that might know that. That would look to see that could affect your ability to get SSI, but I don't know about other assets. So, John, for some of the other assets? Or I'm sorry, not benefits. What am I saying? Benefits.
No, I don't know about lookbacks for those. Honestly, I was going to say that the person who had put in a question said, there's able accounts aren't the only option, and that's certainly true. There are other options. There are supplemental needs trusts and special needs trusts. Some of those can be established by yourself. If the person's come into a really substantial amount of money, you might want to make a separate trust for them. That involves going to court. It's an expensive process, generally slow, and requires legal representation. There are also pooled trusts, which are a really cool option for people who have maybe a little bit less money, they're putting it in, and they don't need to go to court. There's no lawyers. It happens super fast. You basically fund you're basically buying I don't know, I don't want to misrepresent this. You're basically putting your money in with other people's, and it's administered by a nonprofit administrator. One of the ones I know about in Minnesota is that LSS Pooled Trust. I can put the link to that one in the webpage or in the chat. But pooled trusts are a great way to get the protections of those other trusts without all the runaround that it takes to get one set up specifically for your loved one.
Right. Yeah, and we have our guardianship and life planning workshop, and Sue, I've got to ask Sue if that's going to be coming up again. Usually we have that in the spring, but I believe we have one online that we did last year. So I would have to ask Sue, my colleague, and I'm not sure if she's on. She could give that information. Okay, and I'm not seeing. Let's see, open questions. Let's see. Yeah, let's see. In a tax credit building, how's the rental fee cost determined for units set aside for IDD residents? Well, I'm not sure exactly. Do you know that answer, John?
I don't know that they do it based on anything other than the market rate for the building, and then they set it lower than that. But I don't know how that's actually calculated. No. One thing that they do, the way the tax credit works, the tax credit, the more affordable the unit is, the higher the tax credit for the developer. Some buildings will have tax credit units for people who are at or below 30% of area median income, or 50% or 80%. The deeper that they go, the more affordable that they make the unit, the more valuable the tax credit that they're provided. And basically, the more money it's worth for them. So different developers are going to do that differently. Some of them are going to only want a few units at 30% and a few at 50, and a lot of them are at 80. It's just so specific to the development and what their underlying financials are.
Yeah, I know I talked to you about this a couple of years ago, but I think also it could depend on where the location is too, in which city, because there's rules around that as well. So it gets pretty complex. And then somebody, is asking because their son is 17, how would they get out of the house again if they can't apply for those things? We would be able to speak with them a little bit more about preparing for that, but there's also, group residential housing, although I think the My Own Home model, or the person's own home, is not really available to people until they turn 18. So that might be the answers for that. And yes, somebody under 18 can apply for a group home, but it might be under a children's license versus an adult license. And some are licensed or overlap between children and adults. it depends on the provider and their license. And, you know, a person is saying their young adult is in a wheelchair, needs help with ADLs, medications, what kind of housing is available. Again, it should be no different than anybody else, really. The same things. I think where you run into a lot of problems is accessibility, as we know. So there's such a lack of accessible housing out there. We've got a couple of good stories in the past that I can point you to that are on our training page. But I know in some of the past stories, we've had people tell us that they actually couldn't find an accessible unit and actually had to have higher PCA support because they couldn't do them themselves. So say the counters weren't at the right, you know, height for them to be able to do things independently. So they might have to have a PCA system when they could actually do that, and or get up and down the stairs because there wasn't an accessible way to get up and down the stairs. So again, it kind of depends, but we can talk a little bit more about that in the third workshop. And
Waiver will pay for modifications to a home that you control or you
yes,
own up to $40,000 a year. Maybe there's some exceptions for more, but usually it's 40,000 or less. For ramps, grab bars, modifying a accessible van, raising the roof, lowering the floor, etc. So
right. And if
to
they're
keep in
in
mind.
any kind of housing that gets federal funding, and if you ask for a reasonable accommodation under the law, the provider, if it's not causing an undue burden, quote unquote, the provider can or might be required to make that accommodation. And that's a whole nother topic as well, but that's something to know. Well, I know we're a little bit over here, and I guess that's pretty much it. We can have people again send your questions, any other questions. And we really appreciate John and Jerry's help. Here are, again, in 2 weeks, we're going to be doing the What Are the Options, which is one of our favorites. And we'll be featuring 2 stories here for a group of parents, and also for another shared living model, which is new. So again, I'm not going to go through all the resources. These are similar to the last workshop. But if you have any questions on these, go ahead and let us know. Most of them are on the slide deck, and a lot of these connect to the fact sheets that we already had put in the slide deck or that we had been talking about here. So feel free to look through those and email us with any questions. And other than that, I think we're going to wind it up. So with that, oh, and I better do the plug. And of course, everybody, this is our biggest fundraiser. It really is. And it's such a wonderful night. I think 68% of your ticket is tax deductible. It's coming up in 2 weeks, less than 2 weeks. And we really encourage you to come, bring your friends, family members. Like I said, a great way to support us because, as you know, this is free service to all of you. And we'd love to see you there, as well as experience the Goo Goo Dolls. So I think that's it.
Okay, thanks, everybody. With that, I will end tonight's webinar. Good night.